within public health, the Public Health Summit Series allows for a wide scope of medical platforms for those in attendance to receive, ranging from firsthand patient experiences, physician led sessions, and the receiving of vital community resources. By the end of each conference, participants will have a wider scope of literacy, education, community engagement, and furthered advocacy gained from each health and wellness topic presented in this series. The Public Health Summit Series originated from my own personal passion within public health and wellness, specifically within minority health. I personally am no stranger to chronic illness as I suffer from one myself that only impacts 100,000 people in the United States and one in every 365 African Americans, sickle cell anemia. It is conferences such as these that were presented by the Martin Center's Sickle Cell Initiative throughout my life that aided my mother and I with how to properly advocate for myself, learn how to take care of myself, and further my own advocacy and being a testimony for others. Without those conferences, my health journey could have been a lot different, even in the aspect of not being here to speak with you all today. Within my role at Barton University, I wanted to share the importance of having educational conferences such as these because you never know the capacity in which the impact may be. Today is not only for lupus warriors themselves, however, it's for caregivers, loved ones, friends, and anyone else that may take a part in a lupus warrior's care. Chronic illnesses such as lupus not only impact the warrior themselves, however, everyone around them who also deserve the same support and advocacy as their loved ones. Again, I would like to thank you for joining us this morning, and I hope that you conclude today with the broader scope of how you can further become an advocate or maintain your advocacy for lupus warriors. So next, for those of you in person, in the folders you received, there was an agenda. So, so after myself, I would like to welcome the Executive Director, David Hall of the National Center for Racial Equity and Inclusion, to give a brief address on behalf of the university and our center. We will then begin with session one, part one, physician presentation by rheumatologist Dr. Laura Giraldino. Next, we'll have a presentation from the Arthritis Foundation. After that concludes, we will then have a Lupus Warrior panel discussion where you all will hear from lupus warriors themselves about their journey with lupus. We will then have lunch, followed by a live performance by Kelsey Marie. Next will be followed by our keynote address from Lupus Warrior Carla Day. And lastly, we will conclude the conference with a community organization resource fair. Again, I'd like to thank you all for joining us, and I'd like to welcome Executive Director of the National Center for Racial Equity and Inclusion, David Hall, to the stage.
Good morning, everyone. Good morning, everyone. Okay, all right. I know we're just mostly on this side of the room. I was just expecting a little bit off of there. Good morning, and thank you for joining us at the National Center for Racial Equity and Inclusion's Public Health Summit geared towards lupus. We have created this summit to pretty much talk about health disparities that affect minority communities that don't get that much light shed on them. And so it's really to be informative and, like Camille said, about resource sharing as well. Just to kind of give a little bit of background about where we are with the center and my role as the executive director, we both have been at Martin for a little over a year. So we have done a lot within that year, and we have really come to find ourselves doing one of two things: diversity, equity, and inclusion work, and also community engagement work within that. And so for our community engagement work, we do that along the quality of life gamut continuum. And so we found that there are normally 10 areas in terms of quality of life that people should experience but are sometimes barriered by and they need better access to. And so that can be education, please stop by their table. And we look forward to a great conference today. Thank you all for coming.
Good morning, everyone. Thank you, David. My name is Brian Rothenberger. I am the CEO of the Indiana chapter of the Lupus Foundation of America. And thank all of you for being here this morning. For all of you, those of you online, thank you for joining us today. I just wanted to greet everyone and tell you a little bit about our chapter. We have been in Indiana since 1987. The mission of our organization is to basically improve the quality of life for all of those living in the state of Indiana that have lupus. It's estimated that over 35,000 individuals are impacted by lupus in our state. I think the number's probably far greater than that because it involves not just the individuals that have lupus themselves, but it's their family members, it's their friends, it's people that care about them. It really has a very far-reaching impact on those that are dealing with lupus. We are a small team, but we're powerful, and so what we do is through a variety of services and programs, we seek to support those within the state that have lupus, but by providing them with resources to help them manage the disease. We help connect them to others that are dealing with lupus because, as we're finding, or as those who are living with lupus have known for a long time, community is very, very important when you're living with lupus. And then through activities such as this, we're trying to increase awareness and connect people again with the resources that they need to help them live better with lupus. So thank you again for being here this morning. We'd like to thank the National Center for Racial Equity and Inclusion for inviting us to participate today and be a part of this wonderful event. Thank all of you for being here, and hopefully you'll have a terrific day. Thanks for being here. Okay. All right. Well, now it is my pleasure to introduce to you Dr. Laura Geraldina Pardilla, Assistant Professor and Director and Lupus Clinic Director, Division of Rheumatology at Columbia University in New York, New York. Dr. Geraldino Padilla is an Assistant Professor and Director of the Lupus Clinic at Columbia University. She graduated summa cum laude from Intech University in the Dominican Republic and afterwards moved to New York to complete an internal medicine residency in SUNY Upstate, followed by a rheumatology fellowship at Columbia University, where she stayed on as a faculty member. Her areas of clinical and research interest include systemic lupus erythematosus, rheumatoid arthritis, and musculoskeletal ultrasonography. She has been the director of the Lupus Clinic at CUIMC since 2010 and has been awarded a Rheumatology Scientist Development Award from the Rheumatology Research Foundation and an investigator-initiated Pfizer Award to study cardiovascular disease in lupus patients. Her prior research experience as the recipient of a CTSA Award and an NIH supplement grant focused on the role of specific anti-citrullinated peptide antibodies, or ACPAs, in cardiovascular disease in RA using different cardiac imaging methods. In addition to being a board-certified rheumatologist, she completed a fellowship in musculoskeletal ultrasonography with the Ultrasound School of North American Rheumatologists and serves as the director of the Fast Arthritis Sonographic Evaluation and Treatment Clinic at CUIMC. I'd introduce to you Dr. Laura Geraldino Pardilla.
Thanks so much for that nice and long introduction. It's really a pleasure to be here with you this morning So thanks for waking up early and coming for a great cause. So as Brian was mentioning, yes, so I've been taking care of people with lupus for about 14 years now, and in New York, and where our center is located, we do have a very diverse population. So we have a big proportion of Blacks and Hispanics, and as we know with that, we get more challenging and more severe cases. So lupus nephritis and overall wellness is one of my greatest areas of interest. Let me make sure this works well. Good. So yeah, so it's always a pleasure to come talk about this very important topic. And as we know, lupus is a systemic condition. So it's a disease in which our own immune system that would normally be supporting us, defending us from harmful things like, for example, infections. So in this case, it starts attacking our own healthy cells. And because of that, it could vary which organs get affected, and the symptoms can vary a lot. So it could be most commonly that the skin gets affected and we see rashes, the joints can get affected, we see swollen joints, but it can really be pretty much any organ in the body, including internal organs like the heart, the kidneys. So when lupus affects the kidneys, that's what's called lupus nephritis. And while we might think that that's not something that happens very common, it's actually something that happens in 50%. So it's half of people that are living with lupus will have some involvement of the kidneys, which is why it's so important to be aware of this, to know what to be looking for, and do everything we can to try to prevent damage in this organ. So as doing there. So the longer that inflammation keeps on going, then it can lead to damage of the organ. So normally we want our kidneys to be working properly. What they do is that they clean up our system, the waste in the blood in a way, and they help us balance the fluids in the body. So once those kidneys are not doing their job appropriately, then we start getting into trouble with those features. And as you can imagine, then you can have serious health complications that start there in the kidney, but as things progress, can also lead to other complications of, because we're not handling volume well, then your blood pressure goes up, then your heart's overloaded. So it triggers this cascade of serious consequences. And the more it continues to go on for, once the kidneys are damaged, then you might need to then have to resort to getting dialysis, getting a kidney transplant once there's no reversibility of those changes. So let's talk a little bit about how do we manage lupus nephritis. And it's a really multidisciplinary care, and a lot of different things that we have to take into account. Of course, first, sorry, I think I accidentally moved that. But the first thing we think of always is the medications, the immunosuppressants. So we're familiar with that. So we know it's those medications that attempt to taper down that inflammation so that no more damage occurs in those organs involved, in this case, the kidney. So some of those immunosuppressants you might have heard of, but it's things like azathioprine, Cellcept, so medications that taper down that immune response. And steroids are still the cornerstone of treating this, because even though steroids can have a lot of side effects, they act really fast. So 24, 48 hours, they start calming down that inflammation. So we certainly rely on them, but we want to make sure we're not using them for too long and that we can start lowering them as soon as we can, especially once the other medications start to kick in and take over. Another big part of the treatment of lupus nephritis is blood pressure medications. So like I mentioned, it might be that because of the issues going on with the kidney, the blood pressure starts to rise and we have high blood pressure. But even if that doesn't get to that point, even if the blood pressure is normal, some of these blood pressure medications have some protective features for the kidneys. So sometimes, as long as the blood pressure doesn't drop too much in people that didn't get to have the high blood pressure, we introduce these medications too to help the kidney also, because it also protects the kidney specifically. And antimalarials, so things like the Plaquenil or chloroquine. So last but not least, we know those are our great friends in trying to keep the lupus under control. So as old as these medications are, they still help us prevent flares in general, any kind of lupus flare, but in particular kidney flares. So sometimes they're underestimated, and with all the other medications that need to be added once the lupus nephritis is diagnosed, that sometimes gets lost, but it shouldn't, because it also helps us prevent more flares, more damage in that kidney and in the rest of our organs. So a very important piece there. And so that was the part on like specifically medications, but we know it's more than that, right? So living with lupus, what does that entail? So we know that we have to have a very close relationship with the healthcare providers, because it's going to be a lifelong, a chronic and lifelong relationship. So working closely, making sure you feel very comfortable with who is your provider, because this is somebody that should be like, your right hand for anything that's happening, to help you coordinate your care, depending on the different symptoms, different organs that are being involved. Sometimes we need other specialists, and we'll talk a little bit more about that. But working with those healthcare providers and learning. So you're here today, so this is a great step. The more you know about lupus, the more you feel empowered, and you might notice things earlier, you might help detect things earlier and then start treating it earlier, or know what's a red alert, what should I reach out to my doctor immediately, not just wait for the appointment that's in 3 months, for example. So that's really important. And then we'll talk a little bit about diet, exercise, all the benefits, and what are the choices that will help us most in those areas. And overall, what we're trying to achieve is general healthy living. And taking into account each of these components help us get there. So, and as I was mentioning, so we know this disease can present with very different symptoms. So depending on some of those manifestations, we from time to time might need to expand our circle of healthcare providers to include the specialists in different areas. So for the most part, the rheumatologist, I think I keep advancing with that. But for the most part, the rheumatologist and the nephrologist are the two main specialists that will be driving everything for the treatment of lupus nephritis. So as we know, the nephrologists are the specialists that actually get the biopsy done, and that's the way we can confirm that there's that lupus nephritis occurring. But, besides those specialists, then we often need the help of a dietitian or nutritionist, which could be very beneficial if we're facing challenges in terms of what is the proper diet, do we need more guidance, and do we need to balance some electrolytes, potassium, something depending on what's happening with the kidneys, how much damage they have, do we have to restrict fluids? All of these things could be very important. A psychologist is also another great provider, because in the stressful conditions that we're living, lupus aside, everybody, is going through a very rough time, and dealing with all of these things on top of your regular life, on top of your family, your kids, everything that's going. So it could be a lot. So the more help we get, anything that helps us with that, achieving that state of health and well-being should be embraced. Your primary care provider is always a very important specialist here, because they often help coordinate a lot of the other care that's not particularly related to lupus, and could serve as another great point. But if we are facing very challenging rashes, for example, it could be that we also need to get help from our colleagues in dermatology. If it's a heart involvement, the cardiologist. and so on. So it's important to know we have all these resources. So especially when being cared for in a center that you know it's devoted to the care of lupus, usually all of these connections with providers in all of these fields have been established. So we already know like who to send everybody to, who's really the expert within all of these specialists in autoimmune diseases and in lupus, and that can assure the best care and expedite those transitions when we do need their help. So, and working with the healthcare team, the last thing we want is for it to feel like overwhelming, all of this providers, but in a way, you know, it's anybody who's helping us, and it's making us, our disease get under better control, things to do better. We try to embrace that. But some of the things that are good tips just to keep in mind is, you know, keeping track of the medical appointments. And like I said, it could be many different things. So now that we all have cell phones, that is really the best, because it could be hard to keep track of so many providers, different locations, all of these things. So making sure everything is very nicely written, so we are on top of everything, having everybody's cards on our wallet, so that's usually very helpful too. Writing down symptoms. So often, you know, you could have a clinical manifestation here, a couple of weeks it's something different, and it might be that your appointment is not 2 to 3 months later, and it might be an important thing to mention. So to assure we're not forgetting those, it's good to write them down. Another great thing is to come with somebody to the appointment, whether it is a family member, a friend. That is super helpful, because it's very often some of my patients that come with somebody, they're like, remember what happened that day? You told me, and we saw this and that. And sometimes that's very helpful to try to piece everything together when it's not such a clear picture. So that's also very helpful. And last but not least, asking questions, making sure that we are understanding everything. Why are we doing this? We have to do blood again and urine again. Is this necessary? How are my values looking like? Are they stable? Are they improving? Are we, you know, does it look like I'm flaring? How are my kidneys doing? So all of that is very important to keep in mind. And now that things are all in the portal, it's nicer to keep track of things. You can see as things are pointed as red, or they're going in the right or wrong direction. So all of that is very important. And this was sad, but as expected, you know, with all the stresses in the pandemic, access to healthcare providers was felt to be an issue for about half of people living with lupus during the pandemic. So that was really tough. You know, as you know, a lot of clinics they shut down, or people lost their providers. They didn't know how to reach out. A lot of people got lost, and they couldn't schedule another appointment. So it was challenging. So thankfully, we're doing much better, and I think people are back into some better flow and in the habit of following up more regularly. But it did cause a lot of distress. And having half of the people feeling like they cannot easily reach their healthcare providers, it's quite concerning there. But along with those challenges came telemedicine, so telehealth encounters. So some good things about it, some bad things about it. It's not as great, of course, as in person, but it also offers a really good alternative. You might be feeling sick or not strong enough to show up for that appointment, but now you could do a telehealth visit. And there's a lot of things that can be captured, that can be diagnosed and noted during those encounters. So some good tips, though, to make that encounter, you know, as productive as possible. I think we have it here. You know, to make sure that you have a good connection, that you have good light. If there's some rash you would like to show, to make sure then that you're wearing something appropriate for that would facilitate that. Sometimes I tell my patients have a flashlight, because then we can see if there's ulcers in the mouth, or if you have a blood pressure machine at home, we'll check on that so that you can tell me what is the blood pressure today, what was the temperature, and and having your vitals to have a better sense, a more complete sense of what's really happening. So those are some good tips to take into account to assure a productive encounter. And we'll move on now to eating right for your kidneys. And this sometimes is challenging because depending on how severe the kidneys are affected, sometimes we need to limit things like I was mentioning. It might be that we might need to restrict some fluids, or it might be that if the potassium is high, we want to avoid fruits, for example, that are very high, have a very high content of potassium, like bananas, for example, are the most notorious one for that. But that's when things are in that extreme. In general, we just want to make sure that we talked about blood pressure, and that could be a big issue. So lowering the sodium, not eating high sodium content, becomes a priority when we know it should be, it's a good, healthy recommendation for anything, but in particular when we're dealing with lupus nephritis, because we know the kidneys are in trouble there, and high blood pressure is something that could be a complication directly linked to it. So low sodium content, and because of that, trying to avoid things like canned foods, because usually those, are high there as well. And we want to, have that balance of half of our plate. If we're thinking of portions, we want to prioritize vegetables and fruits. So that should be like the big bulk of what we're eating. So, and then we want for our protein, usually some lean meat, white meat or fish, to have as the main protein there. And for fats, what we want to do is the healthy fats. Some of those healthy fats are things like nuts, using, for example, olive oil instead of butter when we are cooking. That's another good tip. Avocado, and making the fat portion kind of like the smallest portion from that plate, or like the big bulk is our vegetables, then we have some fruit, then we have the protein, and some small portion of the healthy fats. Omega-3s are very healthy and encouraged as well, so that's a good one. Some nice sources within the fish could be salmon. So these are some of the recommendations that we're trying to achieve, that low salt and balanced diet, so that we can assure a better overall health. And when thinking about exercise, it's not just because of the physical benefits. It's really physical and also all the mental benefits. It could be that time to relax. We know that stress is very linked to how our health does in general. The more stressed you are, the more likely to have flares, to just not feel well, have more symptoms. And so exercise is something that can help us in both ways. And especially when we are having a flare and we're needing steroids. The steroids, like we mentioned, they're great because they're fast. They act really fast in calming down the inflammation. But one of the things they do is that they make our muscles weak, and our bones weak. So especially when on high doses of those steroids, it's even more important to be up and around to try to strengthen those muscles so that doesn't happen, because it's really like the muscles turning into fat and those bones getting weaker and weaker. And of course, we do some things to prevent that. And vitamin D is one of those important things to try to keep that bone health. And exercise and endurance really comes a long way, especially in those circumstances. And, which kind of activities can we do? There's not a specific restriction. We, of course, want to exercise in a safe way. And we know that exercises like walking, swimming, stretching, yoga, those are most of the exercises that most people can do. But as long as we are being careful not to injure our joints, for example, when they're flaring, exercise is always a plus. So, and at the end of the day, you are your best advocate. So all of these things, taking all of these aspects into consideration, being here, learning more about your lupus, all of that empowers you to be your great and excellent advocate, because nobody would be as good as you, and nobody knows your body as well as you. So, so I would encourage to do that. And I just want to finish here with some tips about, how to improve that communication with your healthcare provider about your kidney health. So, even if you're not having any symptoms, when you're being followed in a lupus clinic with your rheumatologist, they are always checking what's happening with the kidneys, regardless of any symptoms. So they're always checking your blood, and then they're measuring serum creatinine and things there, and they're measuring your urine and seeing, is protein leaking in the urine, or red blood cells or blood leaking in the urine, and sometimes that could be microscopic, so you might not see it, but they are checking under the microscope and seeing those things. So asking your doctors about that. Are those numbers good? Are these normal? Are they, if they're not, are they improving? How is this moving in the right direction? And usually we check on these parameters on how your kidneys are doing 3 to 4 times a year at a minimum, again, regardless of any symptoms. So, being familiar with those numbers and being involved in decision making. So like, what's happening? How is that going? Do we then need to change treatment, add something else to have better results? So all of these things are important. And also to know more about, so what complications can come of this? And then, be more aware of like, oh, blood pressure, or this could be an issue for my heart. And just being more, involved in all of these things. The more you know, then the bigger eye you have for this, and the earlier you can say, okay, this is not normal. Let me reach out to my doctor and tell him about this, that, or the other. So all of these are very good tips. And the overall goal is we want to diagnose and detect things early so that they can be promptly treated and that we can prevent any persistent damage. We want to make sure we catch things early. So it's a pleasure to be here. Thank you. And if you have any questions, any comments, happy to help with those. Yeah, if anybody has any question, please feel free to ask. Yes. So that's a very interesting question. It's about the seriousness or the complications with COVID disease in people with lupus. So as we know, in general, when we have any kind of infection, viral or not, that is a trigger to our immune system, right? Because our immune system has to then fight that infection. So, and that's something that we also see with COVID. Like if you get a COVID infection, often what we see is that there could be a flare of the lupus with that. And that's something that we see in general with infections. So yeah, absolutely. So because of that, as you saw when the vaccines started coming out, there was, who was prioritized? Anybody with an autoimmune disease, including lupus, because of that, the higher risk. So yes, so absolutely. And a second booster is also recommended. So if it's been greater than 5 months since the last booster, so yeah, the more we prevent it, better to prevent flares in general of lupus.
Patients finally getting to the doctor to get treatment? Is it something that breaks down or something that brings them to you? And then the second question is around the mortality. Can lupus actually be your demise?
So two great questions. So, and yes, and we know that our racial ethnic background has a role and a different set of challenges in lupus. So lupus tends to be diagnosed earlier, to be more severe in blacks and Hispanics, for example. So we know that. So, but yet, because of history and, there's mistrust and things that have happened in the past, then not everybody feels comfortable coming to the doctor. And I think it helps a lot, that I am also brown. So I think patients feel more comfortable when they see that their doctors look like them. So that helps a lot. Because in our lupus center, 65% of our patients are black and Hispanic. And I think they feel better knowing that, that I'm there, that we have black and Hispanic physicians there taking care of them. But it's of course, a long-term relationship. So you build that trust, and I think we were set back a bit with the pandemic, with all the miscommunications that that were aired and whatnot. So that certainly made that trust suffer, because people just didn't know what to believe and what to do, and of course that's all very unfortunate. But that's a challenge. And it's history. We know horrible things that have happened in the past to our populations, so that makes us feel uncomfortable sometimes, reaching out and seeking medical advice. And there's a lot of efforts, though, from a lot of organizations, not just the Lupus Foundation, but the American College of Rheumatology, in trying to improve those challenges. And even for clinical trials, we want to know, especially in blacks and Hispanics, how the medications work, because they have more severe and difficult to treat disease. But we usually see there's not many blacks and Hispanics that enroll in those clinical trials, so it makes it a little harder to know. But it all stems from the same issues. So there's a lot of efforts, and it's education and trying to establish a good relationship with your provider. That's the key thing. If you feel like you cannot, trust, or you're not feeling it with that provider, might as well change, because we do want that, and know that your doctor's advocating for you, has your best interest, and so of course that comes a long way. The second part of the question was on mortality. So, can lupus actually shorten your survival? Absolutely. As you can imagine, if the kidneys get damaged, and that leads to then risks for heart attacks, strokes, and all of these things, survival is shortened in lupus. So, but not to sound very grim, and it should be much better, but it's dramatically improved from what it was, for example, in the 1950s. So the 10-year survival back then in the 1950s was only 50%. So we're talking about young women for the most part. So imagine you're diagnosed with lupus and you're told in 10 years, half of you will be dead. That was terrible. So we are in the 90%, which is, of course, a great improvement from the 50s, but it should really be very close to 100. It should be, because young people are expected not to die in 10 years. And so there's still lots to do, but it's for sure improved dramatically. So yeah, we still have a lot of work to do, though. Yeah. Yes.
My such and such died from lupus. Can you explain that you don't actually die from lupus, you die from the complications that lupus causes?
And yeah, and that could be tricky, because then you go, but what was the origin of the problem that led to actually the demise? So the most common cause of death in lupus right now is cardiovascular disease. So it's really, which is the most common cause of death for the general population too. So that's what most people die of, some heart attack, so a cardiovascular event. So, but we realized that a lot of the things that are leading towards that event are because either it was lupus nephritis or ongoing inflammation that started affecting the blood vessels, the heart, and such, and happening then much earlier than normally expected. Like in general, women tend to have heart attacks in their 70s and older. Men tend to have it earlier, actually. So they're more like in the 60s, mid 60s. But it shouldn't be that a woman who's 35, 40 gets a heart attack. So that's where we are, of course, at higher risk at earlier age to having these events. And that really then comes with problems. The moment there's a heart attack, part of the heart's not working, that leads to buildup of fluid, cannot breathe well, a lot of, it triggers a lot of complications from there. So, yeah, so that's one of the main areas. Now, that's why I'm very interested in cardiovascular disease and lupus. How can we change that? How can we prevent these events in our young women?
I just have one more question. I'm with the Office of Senator Todd Young, the Senate office, and in terms of legislation or any governmental funding or interventions, are there any things that the federal government can do or assist with this type of chronic issue or lupus in particular?
Yes, so actually there's designated there's designated funding to look into some of these main complications of lupus that are sponsored directly from, the Department of Defense, the NIH, directly coming from the government. So it's an area of great interest. That there's always marches and fights with how much that budget could be extended, but there's definitely support and resources dedicated specifically to lupus. Yeah. Okay. Well, thanks everyone.
Can we please get another round of applause for Dr. Geraldino? So that concludes part one of session one. We can take a brief, about 5-minute intermission. For those of you that are in person, feel free to grab a snack provided by the Arthritis Foundation in the back, restroom breaks, etc. And then we will resume at about 10:02. All right, if everyone could make their way back to their seats and we can begin transitioning into the next session. The Arthritis Foundation has been helping people with arthritis live life on their own terms for 7 decades. Their goal is to be there whenever and wherever they're needed, providing life-changing information and resources to help you accomplish the everyday things that are important to you. They are a volunteer-driven organization and welcome all who wish to promote their mission. All right, I'd like to welcome Sierra from the Arthritis Foundation.
Good morning, everyone. My name is Sierra Street. Just a little intro about me. I am a current student at Marian University studying biomedical science, and I currently am the Community Engagement Assistant for the Arthritis Foundation. And like she mentioned, the Arthritis Foundation is a volunteer-driven program, so all of our people that work with the Arthritis Foundation are volunteers. So first off, I would like to thank our sponsors, Horizon, Meyer Specialty Pharmacy, and Anthem and Humana. They sponsor our events and our toolkit series to be able to give us the opportunity to share with people across the community. So next slide. Our goals for today, so we want to give a better understanding of arthritis and then give you guys a little bit of overview of what we do with the Arthritis Foundation, and why we matter to you, and the different ways to get involved. And the next slide. Okay, so what is arthritis? So breaking it down, arthritis. So arth is for the joints, and then itis is inflammation, so inflammation of the joints. A common misconception that is just achy joints, and that is not true at all. There are more than 100 different types of forms of arthritis. The most common are rheumatoid arthritis, osteoarthritis, and juvenile arthritis. So lupus and arthritis. So you're probably asking, what is the connection between the two? Lupus is actually a form of arthritis. The symptoms are most commonly associated with rheumatoid arthritis, and it's most similar due to the fact that it is more of a systemic outcome. One of the most common forms of lupus is the systemic lupus erythematosus, causing inflammation due to the immune response. Next slide. So arthritis is actually America's #1 cause of disability in the U.S., and it affects all people of different ages, races, and ethnicities. It is the cause of 172 million missed workdays per year, and that is due to the impacts of pain on fatigue, sleep, physical function, things of that nature. And it costs the economy over $304 million in healthcare costs. 1.4 million Hoosiers live with doctor-diagnosed arthritis currently, and there's 7,350 children in the U.S. with doctor-diagnosed arthritis. In addition, we serve over 92 counties in Indiana, and $6 billion is the annual cost of arthritis to Indiana in direct healthcare costs. So the different beyond the stats in regards to mental health, 48% of patients with arthritis report feeling down or depressed. 57% report that they have little interest and pleasure in doing things. In addition, 58% of adults feel like nobody understands their pain, and then 70% feels that nobody understands how arthritis affects them. Next slide. And another point that I wanted to make on that slide, 54 million adults in the U.S. and also 300,000 children are currently living with arthritis. Next slide. So this is just a slide talking about effects of loneliness and isolation, based on the idea that pain affects different aspects of life. And so this aspect of loneliness and isolation is that no one really understands them. And so that's what we're here for the Arthritis Foundation. Next slide. So the Arthritis Foundation works in partnership for discovery, advocacy, education, community, and connections, in addition to help and support. Next slide. So help and support. So we have different personalized groups, which are connect groups that we do within the Arthritis Foundation to connect different patients with people who have similar types of arthritis, to give them a sense of connection with one another so that we eliminate that sense of loneliness and isolation. In addition, we work in leading the way in juvenile arthritis in the community and care for 300,000 children with arthritis. So we do different events for juvenile arthritis to give also kids a chance to attend events with kids that are just like them, that have similar symptoms, so that they can also feel a sense of connection. Next slide. Advocacy and access. So we are working with insurance, health policy, and legislation to kind of give them a better understanding of arthritis. And like I mentioned earlier, with the missed work days, 172 million work days is a lot. So we work closely with legislation in order to give them more education about arthritis, and so that they can put things into place to help people and patients in their workplace. In addition to scientific discovery, we're fighting for a cure by accelerating the progress and new and better treatments, and building the legacy of existing scientific research in collaboration with complementary organizations. Next slide. So Live Yes. So this is one of our surveys. We have the Live Yes Insight Survey. This is going to be on our table in the back. And this survey is just one of the ways that we can gain more information from patients with arthritis so that we can do more on the education and advocacy front. Next slide. So the in-person community, customized resources, like I said, that are on our back table, and also on our website. We have tons and tons of resources in regards to in your community, how you can help manage your pain with arthritis, in addition to resources that we have available through the Arthritis Foundation to assist patients with arthritis. The Live Yes Insights, it's on our tablets in the back, and so what this is a patient oriented outcome survey that we are trying to gauge based on your pain. How does it impact physical pain, your sleep, fatigue, your social participation, your social life in general, so that we can do more on the advocacy front. And then we have Partners for Patients, online community with our Connect groups, and in-person community. Next slide. So what we do, so data shows that people who engage with the Arthritis Foundation are taking more positive actions compared to those that are not engaged. Patients who get involved with the Arthritis Foundation take better care of themselves. So 94% report that they have a better and positive success outlook on life. 71% start eating healthier diets. 50% begin taking fitness classes, and 50% also start a new weight loss program. Next slide. So this is our website, and these are different ways that you can connect. We have an area on our website that you can find a doctor, access to care, so different resources in that regard. Newly diagnosed, so you can learn, if you were recently diagnosed with arthritis, you can learn more about the type of arthritis that you have, in addition to ways to manage it and different resources available to you. And there's also a part on our website that you can get in contact with us, and so we can put you in contact with the best resources that you need, and also connect groups if needed. Next slide. So yep, this is just talking about our connect groups. Next slide. And so we also have a Live Yes podcast on our website. So that podcast is really good as far as people talking about their impact of arthritis on their lives, and just kind of connecting that way. And then we also have a toolkit series. So we run about 6 toolkit series every year. And basically what that is we center that around different ways to manage arthritis. So we recently had an event or a toolkit series about gardening with arthritis. So we had someone from Purdue AgriBility come in and talk about different ways that patients with arthritis that are having pain and difficulty with gardening, if that's something that you enjoy doing, how can that be accessible to you? We do different toolkit series in regards to food. So how can food help decrease inflammation, things like that. And so as a supporter, where does your money go? 75% of all funds raised goes toward our program services, so like the toolkit series. And 86% of our revenue goes directly towards program and services. 4% is spent on administration and 10% on fundraising efforts. So like I said earlier, this is a volunteer-driven organization. So most of that money is going to go towards helping patients with arthritis, doing events for them, creating resources, things of that nature. Next slide. So we have a couple big events coming up. One of our big events is the Bone Bash. It's actually next Saturday on the 24th. And so this is a big gala that we do to raise money and to just kind of engage with our community a little bit more. It's going to be superhero themed, so you can dress up in your superhero outfit and just connect with different people. And it's a super great event that we do in our community. Next slide. We also are doing our Jingle Bell Run. This is something that we do every single year. You can run, you can walk, however you see fit, or you can just come and enjoy. It's going to be December 10th at Connors Prairie. Next slide. And so this is just a slide. Thank you guys for being a champion of Live Yes. And yeah, we have a bunch of different resources in the back. And thank you guys for your time and attention. Does anyone have any questions about the Arthritis Foundation or arthritis in connection with lupus in general?
Just thank you again to Sierra and the Arthritis Foundation. Really quickly, since we are moving a little faster than anticipated, I wanted to go ahead and promote the Walk to End Lupus that the Lupus Foundation Indiana chapter is having. It'll take place October 8th at 12:30 p.m. at Military Park. So if you have any other questions or need more information, feel free to visit the Lupus Indiana Foundation table that's up toward the front, or it is online at their website as well. We're going to take a brief intermission for those in person to go ahead and visit the organization tables that are already here. Or also, if you would like to, you can go to the front and receive more information about the National Center for Racial Equity and Inclusion, along with the Lupus Foundation Indiana chapter as well. And I forgot to mention before, restrooms are located just right out of these doors. Women's restroom is on the left and men's restroom is on the right. All right, thank you.
All right. You guys ready to rock? We will do that. Or where is Camille? Oh, she's right back there. Well, hello again, everyone. Hi. Thanks again for being here today, everyone. I'd also, again, like to thank Aurinia for making it possible for us to participate today, and would like to thank my new friend Ginger Webb and Dr. Geraldino for being here earlier today. I have the terrific trio here to my left. And you're going to learn a lot more about them in the next several minutes. What we're going to do now is have a panel discussion with these three lupus warriors, and we've asked them to join us today to talk about their journey, about the path that they followed with lupus, the impact that it's had on their lives, and I think that you're going to enjoy what they have to say, and hopefully we'll learn a lot as well, and can probably, those of you that are living with lupus, can relate to a lot of the things that they're going to talk about today. So I'm just going to go ahead and kick things off, and I'll do some brief introductions for each of these three fine folks, and then we'll go into a series of questions. So on my immediate left is Rhoda Pimpton. Rhoda was diagnosed with lupus in January 2011. She works for LabCorp Drug Development in the Project Management Department, where they manage clinical drug trials for many of the major and smaller pharmaceutical companies. She's been in this industry for the past 10 years. Her support squad consists of her family, but specifically her mother, who also was diagnosed with lupus, and her fiance, James. She has 2 kids, a 21-year-old son and a 14-year-old daughter, plus 2 bonus daughters. She became involved with the Indiana chapter of the Lupus Foundation of America in 2016 by way of her rheumatologist at the time. She's participated in walks as a single walker, had teams with her family, and also got her sorority chapter to create a team as well. Referring to our annual Walk to End Lupus Now, which Camille mentioned earlier, that again is happening on October the 8th. Rhoda is actively involved with one of the local chapters of her sorority, Zeta Phi Beta Sorority, Inc., as well as involved with the local chapter of the National Panhellenic Council. She holds the office of financial secretary for both chapters. She chose to be on this panel today because she loves being a resource to others about her experiences over the past 11 years. Please welcome Rhoda. Next to Rhoda is Michelle McGuire. Michelle began her fight in the fourth grade, but was finally diagnosed in 2009. Her rheumatologist suggested she find a support group, so she went all in volunteering for our chapter, LFA Indiana, which of course involved her support squad, including her mom and her partner Brent. I haven't known Michelle for very long, but I've seen her name on a lot of things relative to our chapter over the years, so I know she's been heavily involved in lots of things. Outside of volunteering, Michelle is a veterinarian technician and had her own small business providing home medical care for pets. COVID and lupus forced her to close her business, so she decided to go back to school for diesel mechanics, graduating this summer. She's currently refurbishing an old school bus into an art studio and living space. Very cool. Welcome, Michelle. And to the far left is Chanel Barrett. Chanel was diagnosed with lupus in September of 2015. She joined the staff of the Indiana chapter of the LFA 6 weeks ago and serves as our Director of Operations and Programs. And she's just awesome. I am so pleased that she's with us. She also has a coaching and consulting business focused on empowering women. Her support squad consists of family, friends, fellow lupus warriors, and the women's communities she is a part of, and they are many. Her mother and oldest brother are two of the biggest supporters on her squad. She has 2 young adult sons that bring her joy and motivation for fighting lupus and living well. Chanel participated in support groups and was a model in the Faces of Lupus fashion show prior to joining our chapter as a staff member. She's passionate about helping people improve the quality of their lives and does so through coaching, teaching, and cultivating diverse communities. Her interests include personal development, writing to empower women, gardening, entertaining, traveling, and spending time with family and friends. Please welcome Chanel. All right, ladies. Rhoda, I'm going to start with you with our first question. Is that okay? So our first question for the panel is, how has lupus changed your lifestyle?
I guess for me, the biggest change that I had to learn was the power of the word no. I can't hear myself. I'm like that. Can you hear me now? Oh, okay. Is it on now?
Try that.
Okay. Share mics. Okay.
There we go.
The biggest thing I had to learn was the power of the word no. Previous to my diagnosis, anytime somebody would ask me, like for instance, ask me to be on the panel, I was always saying yes, and saying yes to everything. And then I had to learn that you just can't do it all. And someone with lupus, you deal with chronic fatigue all the time. I remember when I was newly diagnosed, I remember one day I woke up on my bed face down with my coat on because I was so tired after I got off from work. I just went straight to bed and passed out. And I woke up and was panicked. It was like, it's 8 o'clock at night, and I was like, so, I just can't do everything. You kind of have to save your energies, for the things that are important. I can't, if there's 3 events scheduled, I can maybe do 1, maybe do 2 if I feel the energy, but if I don't feel up to it, I can only do the 1 and, apologize and give everyone my best. Like I said, dealing with, fatigue, you kind of have to save your strength and save your energy, because if you go too hard for too long, it'll just make you sicker. So I learned to say no to family, to friends, to work. I was just telling Ryan at work, I have a strict, policy that if I'm supposed to clock out at 4 o'clock, clocking out at 4 o'clock. I'm not checking emails, in my bed at 6 to, try to get this out. I had to learn, like, work-life balance, family balance, friends balance, and organizational balance.
Thanks, Rhoda. Michelle, same question for you. How's lupus changed your lifestyle?
Very similar to saying no. Mine was more making my personal list, because I was always a go-getter, a do everything to the top notch, everything's like extra, over the top, and everybody else's, to help everybody else, and so I really had to shorten my to-do list and the things that I can go do and the things that I say yes that I will help to, or even if things that I'm gonna do for myself, and make the to-do list kept going less and less and less and less, and then so instead of having 14 things I'm going to do today or this week, I'm like, okay, well, I'm going to attempt to do this one thing, and if I can't do it, this is my backup thing, and if I can't do either, for me, being okay with it. That was probably my biggest lifestyle change, is being okay with doing less, which has been really difficult to be used to that. Yeah, just allowing myself to be able to step back and say, okay, this is it, this is what I'm gonna do, being okay with that, and if I'm tired, go to sleep. It's okay. It's okay to be tired. It's okay to not do these things. So, yeah, for me, being okay, making myself be okay with doing less.
Okay, cool, good to know. Chanel, what about you?
Okay, so one of my lifestyle changes, so Michelle was talking about lists. I have to write things down because lupus fog is real. And so having to make lists and things to check off so I don't forget things has been a big thing for me. Like Rhoda said, fatigue has been huge. That's been the biggest thing. Having lupus, one of those invisible illnesses, and because I don't look sick, although I don't know what looking sick is supposed to mean.
Right?
Because I don't think most people that have cancer look sick. But anyway, so that whole people have an idea of what I can do because of the way I present, and I don't go around complaining about it, so they expect me to do more. But fatigue is real, and I live in a constant state of fatigue. Thank you for sharing that, Rhoda, because I was wondering, like, is it only me? Am I the only one like living with a low-grade fever of fatigue all the time, and sometimes it gets worse? So that has been a thing. Earlier on, when I got diagnosed, like my fatigue would hit, it would just come from nowhere. Like I'd be fine driving, but in the early days, I would have to pull over because it's like someone turned the dimmer switch way down.
Oh, yeah.
I got to pull over on the side of the road because I don't want to fall asleep. I'm so tired. I just have to, so the fatigue is real. The sun. I'm not supposed to be in the sun. Well, none of us are supposed to be in the sun, but I love the sun. I literally need the sun so that I can feel well. And so it's like, okay, I'm not supposed to be in the sun, so now let me go buy all these sunscreen clothes. Did you guys know that there's SPF clothes? They're not cheap. Do I buy that? Do I spray myself down? So trying to negotiate, how do I stay well and be in nature and be healthy? That's been a challenge. The way I negotiate it is I use sunscreen and I get into the sun because I'm hitting the beach every time I can. I'm in a cabana, but I'm still, I have to make those modifications. Cancel plans is a big thing. That is a lifestyle change. It's a money thing too, right? If you buy tickets, I'll buy tickets to things because I'm planning for what I want to do. If I don't feel well, those tickets go unused. Or my friends get free tickets, which they probably can appreciate. But it can be a financial thing, like if I made travel plans and then all of a sudden I can't go. I mean, it's okay if you book a flight and you can get a flight credit, but what if, I paid for my room already? It impacts every aspect of my life. There's not one part of my lifestyle that's not touched by lupus. So yeah, and then definitely the work-life balance. That's been a huge thing because lupus is a stress-sensitive disease. And if you're going to all jobs I think have some level of stress because it's a job. It's not called fun. But especially as you like move up in position, there's more stress associated with that. And so can you manage the stress of being able to make a good income and manage your health? So there's been a lot of changes, and I would say like those are some that I'll mention, but it's changed everything about my lifestyle. I'm a different person. I'm like a lower functioning version of myself, basically.
That's a very good way of saying that.
Yeah, so, yeah, that's
Thanks.
me.
You mentioned the word negotiate, and you know, that's been my awareness of lupus over the past 2 months has just ramped up, and Chanel is teaching me a lot directly since we're colleagues now. One of the things I hear from all of you is that organizing your life is so important, and that's one way I have benefited from working with Chanel, because we've had to negotiate how she works and what her work style is. And I realize now why, because she has a certain amount of stamina and energy, and she's got to organize herself as effectively and efficiently as possible to be able to do all of those things that she wants to do. And which is actually having a positive impact on me, because I'm starting to do the same thing. So I appreciate that about what you've taught me, and I'm starting to recognize some of those challenges as much as I can, anyway. Yeah. Did everybody hear that question? Okay. So,
How do we handle other people's expectations of what
yes.
being able to do or not do? Stressfully. I know for me personally, it's, I hate to say, I'm like, well, I have lupus, so, you know, it's just depends if I'm going to be able to make it. But sometimes I have to break out that lupus card and say, look, I can't quite do that or do this, or like I will try to put that on my plate and see what I can do. And that's usually how I kind of go with it. I'll try to put it on my plate and see what I can do. But for the most part, it's really stressing to try to have to deal with what other people expect from you, because you don't look sick. You know, you look like you're a healthy person. What is wrong with you? I don't understand why you couldn't do this, that, or the other. Aren't you a diesel mechanic now? Can't you work on this vehicle? Aren't you? I'm like, if you can do that, then can't you do this? And so it's a lot of, I will try, and then let them know, like the day before or the day of, or sometimes, unfortunately, it's like the hour before, and I'm like, I just can't. I just can't. And I just have to be honest. I'm like, I just can't do this, and I'm sorry. Apologize, be honest, and then try really, really hard not to take it personal if they get upset, and then try really, really hard on how to not be stressed out about not being able to do that. A lot of times I do feel like I shouldn't have to feel like I need to apologize, but I do always feel like I need to apologize for the fact that I'm sorry, I'm sick, I can't. I hate saying that. So just like, I can't do that right now, and I'm so sorry.
I put on, I was going to mention that later on, because on my list of things that help me cope, saying no unapologetically.
Oh my gosh, how do you do that? I want to know.
I just have to create a block in my mind, and I don't too much manage other people's expectations, because that's their business. And what they expect of me doesn't mean that's what I'm supposed to do or how I'm supposed to show up. So I decide, you know, what I'm going to do and how I'm going to do it, and that's what I do. And if it doesn't meet expectations, then it's like, it kind of is what it is, because I have so much to manage my own emotions and feelings about my limitations that I don't have time to manage other people's. And I let them do their job with that. So that's the biggest thing. And it depends too, right? So like at work, it's different. And so it was funny. It was like, what was it, 1 or 2 days ago? Brian was like, well, I'm worried that I might be overburdening you. And I'm like, don't worry, because I'll tell you no. And I'm not going to feel, I'm not going to feel bad about that. That's how I take care of myself. It's really how we all should take care of ourselves.
Yeah.
But when you have lupus, it's more important. So, and then too, with family and friends, they kind of all know I'm making plans, and if something changes and I can't show up, then I'm going to let you know I can't show up. And I felt bad about it for a while, but I stopped feeling bad about it. And then there's a lot of support. Like, there are a lot of travel plans that might need to change with my kids, but they're totally understanding and supportive. Like, okay, how do you feel? Sometimes I press my way. But yeah, I just kind of have grown into saying no unapologetically. I'm doing the best I can to manage this body here, and I'm gonna let everybody else manage theirs and their emotions.
I also feel the same way. At the time when I was diagnosed, my kids were smaller, and I was divorced, so I was single mother, raising 2 kids. So my responsibility was to them. So I had to learn to tell people no, because I need to save my energy to manage them, and they're my priority, not my sister needs me to run with her to the mall to go pick up X, Y, and Z, or hey girl, let's go do cocktails. I had to learn to say no. And eventually, over the course of the years, people understood. Like, hey, I see that you're dealing with this. I see that you've been in the hospital, that you're tired, and I've been grateful that I've had a good support system and people that have been understanding in my life. And the people that haven't, they kind of have faded away.
Okay, thanks. Thanks, Robin. You want to ask a question? Go ahead. Yeah. 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 Mm-hmm. Yeah. 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 Thanks for sharing. Yeah, it seems lupus has lots of sisters.
Ugly sisters.
Unfortunately, yes. Well, thank you. Thank you for sharing. The next question, I'm going to start with Michelle. You want to kick this one off. What has helped you manage your lupus?
Sleep. lots and lots of sleep. Oh my goodness. And being unapologetic, that I can be unapologetic for. I had like 17 hours of sleep. I'm like, I slept right through that alarm. I slept right through that event. I'm like, I'm sorry, I was so tired. But I could literally sleep like 17 hours, 5 days in a row. And when my few hours that I am awake, just who knows what I get done? And nothing. I may get nothing done.
Yeah.
But yeah, probably sleep is the biggest thing that helps me manage my lupus. So unfortunately, I don't really have a job anymore because of lupus. So I guess I have that fortunate ability that I can sleep 17 hours a day because I don't have employment anymore. So that's probably the biggest thing that has allowed me to heal and feel as good as I do now.
Chanel, what about you?
Well, I wish I can get some of that sleep.
Sure.
I have a list of things. So social support is big, friends and family. I talk to my mom and my oldest brother every day. That helps. The emotional support. So sometimes, like, I might cry about something because lupus sucks, and there's different levels of grief that goes with it. So that's huge. Having family and friends with me at treatment. I've had to do chemotherapy several times now, and so I have someone take me, drop me off. I'll have someone be there with me while I'm getting the treatment. Might have someone later, so involving them. Saying no unapologetically, managing stress. And then when I have the energy and I can, I try to have as much fun and live my best life whenever I can.
Yes.
As long as I have the energy. And I'm living it up, and I'm taking a bunch of pictures so that when I'm down and I'm sitting on my, here? Okay, sorry, thank you. When I'm down and I'm sitting on my couch and I can't do anything, I can scroll through my pictures and relive all the good times I had when I had the energy.
Okay, thanks. Rhoda, what about you?
Okay, so the biggest thing I had to learn was stress management. I am a sensitive soul. So I take in people's feelings and take on people's woes and anguish. And so it would get to the point where I would be so stressed out over other people's stuff, it caused me to flare. So I had to learn to, one, find healthy ways to deal with stress because I have, outside of other people's things that they have going on, I have my own stress, like school. I was at the time going for my MBA. So I had school stress, I had work stress, I had children's stress. So I learned to, like Chanel, do things that were fun. Or if I couldn't take trips, like listen to music. Sometimes even I don't know, this is my little thing, but I love washing clothes. So washing clothes, folding clothes, that was something that calmed and balanced me, trying to find things that bring me peace. And if there were people in my life that were causing me undue stress and I was letting them know, hey, listen, you're just gonna have to calm down a little bit, ma'am. I can't deal with that. And if they continue, I guess that's one of the biggest things that has happened in my life. There were a lot of people, a lot of friends, even some family members that I kind of had to distance myself from, or friends that I had to cut out of my life because their energy was causing me harm. So that's one of the biggest things that I had to learn how to deal with.
Wow. Thanks. This is sort of an extension of that question for me, but I'm hearing more and more about the mental health aspects of lupus, and suspect a lot of that is related to the stress. And how do you deal with that? dealing with the diagnosis first, and then the uncertainty of a flare. I guess, how do you handle that uncertainty? That's really what I'm intrigued about, because that would create a lot of stress for me, not knowing when I'm going to flare or when something is going to come out of left field and hit me. How do you learn to deal with all of that?
So when I got diagnosed, I guess I kind of told my story. I went to a water park with my friends, well, with my friends and family, and I was out in the sun all day. Got home, and the next day I was as red as lobster. But then afterwards, something just didn't feel right. And then I remember I would brush my teeth, and my teeth were just bleeding. And I was like, oh, I must have to go see the dentist. You know, maybe gingivitis real bad. And then I remember the day before I went to the hospital, I woke up, and my pillow was covered in blood. And I was just like, oh, my teeth are really bleeding. I just really need to go to the dentist. I'm thinking it's, you know. So then I went to work, came home, and I had, well, they call it petechiae. So it looked like little red dots that looked like I was bleeding my skin on my legs. And I remember, well, at the time I was married, so my husband was there, my sister came over, and they literally had to drag me to the hospital because I was like, no, I'm just gonna call the doctor and make an appointment, you know, it's not, and they literally had to drag me to the hospital. And then when I got to the hospital, they had no idea what was going on. They did a blood test and saw my platelet count was 0. And they said that literally I could have bled to death in my sleep because my platelet count was so low. So they admitted me to the hospital, and then I remember that night in my bed, I remember crying, thinking like, please, Lord, just let me get through this because I don't want to die, because who's going to take care of my kids? So I had to, you know, learn, one, to take care of self, go to the doctor, because that was my thing, like how they were talking about earlier. Like going to the doctor, the only time I went to the doctor before then was when I was pregnant. I just didn't go to annual physical, what was the annual checkup? You know, I'm fine, my limbs aren't falling off, so why do I need to go to the doctor? So I had to learn to trust others, like trust medical professionals, trust my family. They could see something was going on, and I just didn't want to accept it. So, you know, you have to, like I said, learn to trust others. You know, trust yourself now. Now I know, like, if I'm not feeling good, then I'm going to get in the bed and lay down. Yeah. Before I would, you know, like Chanel said, thug it out. I don't do that anymore because there are other people that are counting on me and relying on me and make sure, and I have to be good for them as well as for myself.
Sure thing. Thanks. Michelle or Chanel, anything to add?
I can't. Hello? Okay. I can't say that I manage it.
Okay.
I don't manage uncertainty. Because it's so uncertain. When I got diagnosed, it was completely came out of left field. I didn't have any traditional symptoms of lupus. And I saw 2 doctors on that first day. It was a dermatologist. That's the only organ damage I've had from lupus up to this point. And I saw the rheumatologist. And the dermatologist came in, and she's like, listen, you have lupus. You need to take care of yourself and get rid of stress, or you'll die. It's just very, very scary, obviously. And the fact that, and even the rheumatologist I have now, like there's such great uncertainty that I can't be certain about anything except how I will deal. Like I have to come to not to be grim, but it's just facts. Like I could die. Everything could be going okay, and something could be wrong, even with treatment, things can turn left and I might not be here, having to be okay with that. Then having to consider if things get really bad, what am I willing to do? Like if we had the lupus nephritis talk earlier, do I want to do dialysis? I mean, I don't know that I would want to do that, so just coming to, like, if there's an issue of there's a treatment that can be done, do I feel like going through that for an extended period of time? Because even with the chemotherapy I mentioned earlier, if you have cancer and you take chemotherapy, the point is you take the chemotherapy until the cancer is treated and then you stop. Most of all of the lupus drugs are chemotherapy drugs that can cause other problems. So it's just like, okay, so do I take the medication and then potentially deal with the side effects today and maybe some extra side effects tomorrow? Or do I not take the medication and get accrued damage? So for me, there is no certainty. And so it's just like being okay with that and then just taking it one day at a time and just trying to live my best life the best I can. But it's kind of like you get comfortable being uncomfortable,
Okay.
being comfortable with uncertainty.
Yeah.
There really is no way to manage it.
Yeah. Okay.
I haven't quite figured out how to manage the uncertainty
Yeah.
at
Okay.
all, really. For the most part, I wake up and figure out how I feel that day, and then, and that literally is how it is every single day. And sometimes it gets the best of me, and sometimes I'm like, cool, okay, well, let's do this. Another time, and then I would like, or, okay, cool, I need to go back to sleep. Let's do this. But it's really, I haven't really figured out how to truly manage that uncertainty. I kind of, again, hate to be grim, which is so true, because, I too had my, when I was first diagnosed, my doctor's like, all right, well, if you don't start slowing down, you literally have 3 to 5 years. At the rate you're going, 3 to 5 years. What do you want to do?
Yeah.
Do you want to slow down?
Mm-hmm.
Or do you want to be gone in 3 to 5 years? Well, at the time, I'm like, well, that means I would never see my son graduate even high school.
Yeah.
So that kind of forced me to chill out and start organizing my life and figuring out what is important, get rid of the rest. And, it's been, I don't know, however many years since 2009. My brain can't count right now. But, so I've gotten to that point where, okay, I've passed that, obviously, that 3 to 5 year mark, so woohoo. But I still haven't figured out how to totally deal with that daily not knowing what I'm going to do, not knowing what I can do, trying to make appointments, trying not to do. It's really, it kind of gets to me on most days,
Sure.
so I haven't necessarily figured out how to manage that.
Well, thanks. So one thing I'm hearing as you all talk is that, yes, you're concerned about yourselves, but oftentimes you all, and everyone I've met who's dealing with lupus is thinking about others, the people in their circle, and how they can take care of them with limited resources. So how can those of us that are part of your squad, family members, friends, how can we best support you? And I'll toss that to Chanel first. What can we do to be supporting all of you?
I think, well, let me reference this. I think I remember this one pretty good. Okay. Be gracious and understanding when we have to cancel plans. And don't assume that we're okay because we're not complaining. Because if you call me on any given day and you say, how are you doing? I'm going to say, I'm well. Because that's what I'm speaking for myself. That doesn't mean I'm necessarily feeling well. So just if a person has lupus, it's bad to assume generally, but assume that they're probably not feeling the greatest and treat them with grace and understanding, knowing that they're probably not feeling their greatest.
Thanks. Rhoda or Michelle?
I'm referring to my notes.
Okay.
I know I too had notes that I was referencing before I came up here because I didn't want to be fumbling. do my things. But I guess for me, the biggest thing that my support system has been really good about is how can I help you? You know, they ask me that all the time. Like, my son will come over, Mom, you need me to go do some, you know, we have a dog, you know, take Mocha outside or do this for the dog. Now, that wasn't necessarily the case when we first got Mocha. A lot of it fell on me. Yeah. But now, if they see that I'm tired, they'll ask, you know, Mom, what can I do to help? You know, my daughter, like, can I mop or clean up? My fiance was asking me, well, what can I do to help? I said, well, you know, if you want to be a real big help, I was like, hire a cleaning service to come deep clean my house for me. You know, like, do some of the things that I'm too tired to do. So just asking how you can be of service to them would be the biggest thing that people can do for somebody dealing with lupus.
Okay, thanks.
I'm not sure I can add much more to either of those, because I would say mine would be the exact same. You know, be okay with us being not able to do some things or have to change plans, and help out. For me, it would be like, don't ask me, because I'll say, oh, I'm fine, no, I have it. That's me. When really I don't have it. And even as it's coming out of my mouth, I know I don't have it, but I'm not going to tell you I don't have it. So just do it. Like, if you know I'm struggling, or if you know I need some help in something, just help, or just be okay with it without me having to say something. Or if I can't get the dishes done and now we are down to no dishes and you're going to have to clean your own, well then just clean your own and just do it. How about just do all of them? Don't ask me if you want me to do the dishes. Just do all of them. Yeah. And that would be awesome. That would be for me.
Okay, cool.
Rhoda, can you talk to my support squad and tell them to start asking me what I need and what I need for help? I'm just playing.
No, seriously, I kind of had to train them, like, because I remember one time I had a surgery, and we had just got the dog, and my kids, they begged me to get the dog. So we got a dog, and I literally got out of the hospital, and I'm hearing dogs, and, you know, I had to get up and be like, listen, you know, I am already tired. I just had this surgery. You guys know what's going on with me. Do it. You know, and sometimes you just kind of have to, you know, get forceful with the people in your life. Like, hey, you know I'm dealing with this. You know, this isn't brand new. You know, I've had, you know, lupus now for 11 years. You know the deal. You know, shape it up. You know, if you love me, you'll support me and you'll help me. You know. Yeah. And then they after that, they kind of, you know, snap into shape and kind of get it.
Thank you. I'm going to give them a pep talk.
What, Rhoda, I'm going to start back out with you, but what, is there something that you haven't talked about that we haven't heard this morning about lupus that you'd like people to know about? Is there an aspect of it that you'd like to share that we haven't heard about yet?
Well, I think some people have, you know, I guess preconceived notions about how it affects everybody, because like the things that I deal with lupus, you know, Chanel might not deal with, Michelle might not deal with. We're all individuals. Yeah. Like, you know, in my family, I was the first one diagnosed, but then maybe 6 months after I got diagnosed, my cousin did. And, you know, with me, it affected my platelet count, affected my blood, whereas with her, it affected her lungs. She was having problems breathing and had to be hospitalized several times, like even more than me, due to that. And then maybe about 5 years ago, my mother got diagnosed. She had been dealing with it all of her life. When she was little, they would take her to the doctor, and the doctor didn't even know what was wrong with her. And then she happened to have a major flare about 5 years ago, And when she was going through the symptoms, I was like, Mom, I was like, you need to talk to your doctor. I think you might have lupus, because she had the like butterfly rash on her face. And the doctor went, her primary care doctor told her, no, there's no way, you're too old to have lupus. And I was like, no, Mom. I was like, I think you need to be forceful and ask them for a referral to a rheumatologist. And they did. They tested her, and then lo and behold, and then she was able to get the treatment. So it just, you can't look at one person and say, okay, well, like for instance, my trigger is sun. I can't be in the sun long. It causes me, as soon as I'm in the sun for too long, I am either really sick or I've been hospitalized. Whereas somebody like Chanel, it may affect her, but she may not be as sensitive to the sun as me. So it just depends. It's individual.
Thanks.
If I know I'm going to be, like, I went to Cancun. My brother got married in Cancun. So when we went to Mexico, it was a lot of hats and and strong sunscreen. And even outside of that, just limiting my time in the sun. So there were a lot of times where they were doing things during the day. I would pop right back out in the room and relax and chill. And then we would go out to dinner when the sun went down. Mm-hmm. Yeah. Mm-hmm. Right.
No.
Yeah, and it's about being prepared. So like, my kids both were into, they did go-kart racing. So when they would have events at the speedway track, there's not a lot of shade out there. So I would go prepared, like I would have an umbrella, have my sunscreen, and if I feel that I'm not feeling well, I would go get in the car, turn the air on. So just about being prepared, because you know your body, you know what's going on, you know what you need to do, because most of us have been dealing with it for a while. So you just need to, you know what you need to do, and just do it, and make sure you take care of yourself.
Yeah. Michelle, anything to add?
I would probably say not to make one person's, what they're dealing with is more or less than what you're dealing with, but understand that when you say you're tired and I say I'm tired, it may be two completely different kinds of tired. Yeah. Or, you're like, oh, I'm just wiped out, or that was a busy day, or I'm exhausted, or whatever the case may be. If you're complaining about the same thing that I'm complaining about, just understand that they're not the same complaints. Not to say that mine's worse than theirs, but they're not the same complaints, and understand that and be empathetic to that fact. It's like, yeah, you're tired, but you're going to keep pushing. Well, I'm tired too, and I can't keep pushing. I'm done. Yeah. End of story. So just understand we may be complaining about the same thing, but they're not the same thing to each of us.
Yeah. Okay. Good to know. Chanel?
I'd say just understanding that a lupus diagnosis is kind of like I feel like lupus is like a gateway disease, because it can cause other diseases to happen, in particular other autoimmune diseases. So I got diagnosed with lupus in 2015, but in 2019, I got diagnosed with an ultra-rare autoimmune blood disorder that caused blood clots to form in my vessels. So when my blood went through, it got shredded. Same thing Rhoda had. So that was caused by lupus. And so I have to be treated for that and follow with hematology for that. I had to go through plasmapheresis for that. For those of you who don't know, it's basically you go to the dialysis center, you get rid of your plasma and get donor plasma. I did that for 7 days. And then I did chemotherapy. Okay, so and then on top of TTP, which is that ultra rare autoimmune blood disorder, I have autoimmune neutropenia, another thing that's impacted my blood. I have inflammatory arthritis that has come from that. So it's like, it's not just lupus. It's kind of like lupus had a little party and like brought some other diseases to the party. And I'm like, no, I like parties, but not this kind of party. So, I mean, when a person is dealing with lupus, usually they're not just dealing with one thing. Some people deal with chagrins and, is that how you, yeah?
I have
So, like,
Sjogren's
I don't
and
have it,
Raynaud's
but my
and-
throat gets really dry, so that's why I bring my water bottle and I'm having a drink so that I can talk. There's all different types of things that happen. So just understand that when a person has lupus, as bad as lupus is on its own, sometimes it brings some little gang members of other diseases that, you know, so you got a whole bunch of things that you're dealing with. So I think that's important to know. And just give us a lot of grace. Because we're here, and back in the day before they had medications, you just had, 4 years maybe.
Yeah.
We're here, but we're warriors. We're fighting to be here. So even if we don't complain, even if we're not talking about it, you need to know that a person who's dealing with lupus, they are fighting to live. And some of us, you know, some of us can just survive. I want to thrive. So I don't want to just survive. I want to live my best life. But we fight. So, yeah.
Cool, thanks.
That's what I got to say.
Thanks. Why don't you go ahead and keep the mic, Chanel? We got time for one more question here. So what's one takeaway you would like all of us to walk away with today?
One takeaway. Lupus is serious. It sucks. And while I feel like the name lupus, it just seems like, oh, it's lupus. Like, no, it's serious. It's a very serious matter. And we don't get as much support as we should. As other organizations like the other diseases, breast cancer and things like that. We need support. We need funding. We need research. It's a serious matter. And like the doctor said earlier, it impacts Black and brown communities more than any other community, and the disease process is often more severe. So one takeaway is, know that lupus is serious, more serious than it sounds probably most of the time, and we need support so that people like me, Michelle, Rhoda, and the others in the audience that have lupus, and our families, can live a good life.
Thanks, Chanel. Michelle, do you have a takeaway you'd like to share?
I thought I just did.
Okay. Fair enough. Yep, you did.
I think probably everything we said is a good takeaway.
There's a lot. Yes.
Just acknowledge and support, and even just the slightest thing of saying, okay, that's it. Just say okay. I'm like, you're saying you're tired. I don't think so.
Yeah.
Okay, and be nice with that.
Yeah.
That is simple enough. That right there
Yeah, sometimes
is support.
there's nothing
That's-
that we can do.
No, there isn't anything you can do. So just say, okay, that's okay. And truly mean it. And just that simple little action is support all in itself.
Yeah. Okay. Thanks. Rhoda, anything to add?
Well, I guess it's a good takeaway for just anybody, even people not dealing with lupus, is making sure, like self-care, making sure you take care of yourself, and making that a priority. I guess one thing I was really bad about was I would take care of everybody else and then be spent and didn't have anything for myself. So, and like I said, that's good for just anybody dealing, people that aren't dealing with lupus, is making sure you take care of yourself.
Yeah.
And then, and one thing that I'm in my sorority, we just be a service to others, making sure that, if you see somebody that's struggling, help. You helping somebody else isn't going to hurt you, and you might affect a change in them that, might brighten their day.
True.
Or help them from falling off the deep end.
Yeah, true. Thank you. Camille, do we have time for a question or two from the audience? We doing okay? Does anybody have a question for the panel?
Thank you.
Thank you.
Please.
I think it just depends, because like for me, it was the bleeding. But like my cousin, she had issues with her lungs, and she would get home from work and then couldn't climb up the stairs because she would run out of breath and like almost pass out because her lung capacity was diminished at that time. And then my mom, she started to get like the rash, but it started the rash all over her body, and she ended up even losing her hair at one point. So it depends on the person, and I think that's the reason why a lot of times people with lupus, it takes them a long time to get diagnosed. There are some people that I know it took them, like Michelle was saying, she was dealing with it in 4th grade, didn't get diagnosed until 2009. I guess that kind of deals with like the uncertainty of it too. It's just when you feel, like in my case, I felt something was wrong, but I just kind of ignored it. If you feel that you know your body, and you feel something's not right, then just go get it checked out and figure out what's going on.
For me, it was joint swelling. Like in 4th grade, it was swollen wrists and swollen knees. And being in 4th grade, you don't think of a kid having some kind of autoimmune issue. And we had gone to the doctors to try to figure out, because, a 4th grader shouldn't have swollen wrists and can't hardly write and do their schoolwork. And they're, doctors are always like, oh, you're just growing, or there was always some explanation that was just explained off, and you just have to deal with it, which is why it took me forever to get diagnosed. Because at some point, at one point, you get tired of going to the doctors, and the doctor's telling you, it's like in your head, really, this isn't happening. And so then for decades, I stopped going to the doctor altogether until it went back to my joints again. And I started having hip problems and shoulder problems, and my son had to help me get my shirt on and off. And I couldn't hardly write or type on the computer because my finger joints were swelling, and I was struggling to walk because, come to find out, my hip joints were swelling. And then at that point was when finally the doctors were like, all right, well, maybe there really is something wrong with you. So mine started off with joint swelling.
I know I've never had the butterfly rash, but that's like a very common telltale sign where people have the discoloration in this area. My symptoms didn't look like lupus at all. It's just because I have a brilliant doctor who knew to get me moved to the next part. But I think in general, the butterfly rash is a super common sign.
Any other questions? Yeah, please. The question, thank you very much.
Yeah.
I'm going to repeat it so that everybody can hear. The question was, have you experienced any challenges with methods of treating lupus that were sort of outside the normal channels?
I had actually been in clinical trials for 7 years. I just rolled from one lupus trial to the next lupus trial to the next lupus trial. Because at the time, Benlysta wasn't out. Insurance was only paying for Plaquenil, and that was only like partly. There really wasn't a whole lot else that I was on NSAIDs for anti-inflammatories for my joints and things like that, but I needed more, and I needed more faster, because that was at my 3 to 5 year mark, and I'm like, well, if I got 3 to 5 years and a clinical trial kills me, what's the difference? At least I tried. So my outside the box was 7 years of clinical trials, and then when there was no more trials for me to go into, it took almost a year. Benlysta was finally out, and it took almost a year to get insurance to finally pay for Benlysta, because it was like $12,000 to $15,000 per month to get Benlysta. And so finally, after a year, our insurance finally paid for Benlysta, and that was a really rough year. But my outside the box was actually going to clinical trials.
I didn't directly deal with the insurance, but my hematologist really had to fight back and forth with the insurance for me to receive the chemotherapy treatment for TTP, and later with lupus. It's very expensive. I was in the hospital for 11 days, and I think it was $120,000. I didn't have to pay that out of pocket because I had insurance. Each time I've had my chemo infusion, they're about $64,000 each, and so that's like I have to get them, get 2 of them. So yeah, I'm grateful that I have doctors who will fight for me because the insurance doesn't want to pay for it. And another thing to bring up with that, there are a lot of natural treatments that people have successfully used to fight lupus, but it's very expensive. One of the biggest ones being stem cell treatment. Obviously, that's going to cost a lot of money. So people who have access to those kind of resources can try those out, and then those who don't are not able to. Functional medicine doctors, they do a lot of things and a lot of natural things, but functional medicine is generally not covered by insurance, and the testing is not covered by insurance, and the treatments, which are not necessarily pharmaceutical drugs, aren't treated as either. So that's not been a huge challenge, but that's something that I want to do. I just know that it's going to take a lot of money out of pocket on the front end, which means that I can't do other things.
Rhoda, anything to add?
Well, I really haven't. I guess I've been lucky that I really haven't had too many difficulties with medicine, because when I got diagnosed, they prescribed me Plaquenil, and that's kind of been what I've used the course of, since 2011. I guess the only challenge that I had was here recently during the pandemic, when they had suggested that Plaquenil was like a treatment for COVID. There were like shortages, but my insurance was really good about letting me renew sooner. So I'm like because it's my daily medication, I get it 90 days through a mail-in pharmacy, and they were able to let me refill earlier than normal. So then that way I had a stockpile in case there was an actual shortage, because they knew that this was a medication that I need to take. Because there was a point where my doctor thought, well, right now things are kind of mild, maybe you can come off the Plaquenil. And then I went off it for about maybe 6 weeks, and I was right back in the hospital. So I know that I have to take it, I need it.
Yeah. Thank you all. I need to wrap things up. If you've got other questions, these ladies are going to be around for a while, hopefully so. feel free to come and talk to them individually and collectively. Thank you, Rhoda, Michelle, and Chanel. We really appreciate your time and your experience today. Thanks for sharing with us. And thank you all again for being here. I'm going to invite Camille up. I think it's about time for lunch.
Just want to say thank you again to our panelists. So on the live stream end, we're going to go ahead and take an intermission, and we'll return at about 12:05 for a live performance by Kelsey Marie. As far as those in person, it is time for lunch. It is self-service with utensils provided, so you're more than welcome to make your way over. And please get seconds and thirds. It's a lot of food. So thank you.
And I am going to share some music with you today. I'm very excited. I wanted to say thank you so much for allowing me to be here. A special thank you to Chanel Barrett for inviting me here today. I get to do one of my favorite things, which is share my music and my messages. But first, I'm going to start off with one of my all-time favorite songs called What You Won't Do for Love by Bobby Caldwell. If you know this, I want you to sing with me, okay? Just a minute. Good. I just want to say thank you so much to the panelists as well. It takes a lot to get up here and be vulnerable and tell your story. And for somebody who doesn't know as much about lupus, it's really informative to understand more about it. So I'm really grateful for this opportunity to be here and for your guys' strength for coming up and just being really open and honest. That's something that's really important to me in my music too, is to be vulnerable and to speak about the truth, even when it's not pretty. So let's see, how are we feeling over there? Need another minute? Take your time, no rush. So I'm actually an independent artist. In 2018, I started working with an independent record label called MECAP, and since then I've put out 8 songs and 8 music videos. So wherever you listen to music or if you love to watch music videos, please feel free to check them out. One thing about me as an artist is I really strive for truth. I actually have a song called I'm Here to Bring the Truth. So it's really important to me, and what I do is really a very godly experience. So everything that I write really comes through God. And that's just let's see, I think nope. Okay, well, I do actually have one song that I was planning on doing a cappella. So I might go ahead and just do that really quick for you guys while we're working on this, okay? Um, This is a song that I have loved for as long as I can remember, and anytime I'm ever feeling down or just not feeling strong, I sing this to myself. And I really want to give that to you guys today too. So if you're not feeling strong, if you're having a weak moment, whatever you're feeling, just either remember this moment or remember this song and start singing it to yourself, okay? This is called Smile by Nat King Cole. Smile, though your heart is aching. Smile, even though it's breaking. When there are clouds in the sky, you'll get by. If you smile through your fear and sorrow, smile and maybe tomorrow you'll see the sun come shining through for you. Light up your face with gladness. Hide every trace of sadness. Although a tear may be ever so near, that's the time you must keep on trying. Smile, what's the use of crying? You'll find that life is still worthwhile if you just smile. You'll find that life is still worthwhile. you guys. Thank you so much. I appreciate you. Thank you. Music has always been such a huge part of my life, and I've always loved like artists that have just kind of really led the way. So Nat King Cole, Etta James, Etta Fitzgerald, Louis Armstrong, Al Green. You know, those are the people who really, really inspire me. But more current day, I love Miss Lauryn Hill is like my all-time favorite artist ever. And then I love people like Jasmine Sullivan, people who really tell a story, people who don't just do what everybody else is doing and kind of go with the flow of things. I think music is very powerful, and it can be either used for good or used for bad. And for me personally, I choose to be a light in the world of darkness, especially in the music industry. It's very, very dark, especially for a woman. But I refuse to, fall for that. I want to just be as strong as I can possibly be. And I hope to really inspire a world of people, but especially the young women out there, because we get to see so much that's not right. But what about, some good examples? So that's something that, I really aspire to be. When I was starting out, I had my manager, who's an incredible human being, by the way, but he wanted me to start singing about, a broken relationship. And I felt like that's what everybody does. I would much rather sing about a broken system than a broken relationship. So luckily, they allowed me to be who I am, and I was able to put out a song that was about a broken system, and it's called I Just Can't. That was the very first song that I ever put out into the world, and then I moved on to just creating messages that are really strong and, just to inspire people. And that's really my biggest goal with music, so I hope you feel that today. I'm sorry we're dealing with a little bit of technical difficulties. Hopefully we can get some stuff going here. Is there anything that I can do to help? I have it on my phone, too. Would that be helpful? I wrote this. Well, I'm going to do one cover, but I wrote all the rest of the songs. The cover is called, it's like a different instrumental version, though. It's not like the regular song. You could do them a cappella, but it might not be as fun. So I've gotten to do quite a few things. Like I said, since 2018, I've been working with MECAP, and I've been putting music out. But I've gotten to do a lot of really cool performances, which is actually where I met Miss Chanel over there. I got to sing at the Madam Walker Theater, which was just incredible. So many people have sung there before, and I got to be at the Babyface concert. I just felt so blessed. But she actually walked up to me after I got to sing some of my own songs and told me how much it inspired her, and we got to speak later on the phone. And she may not know this, but I was really fighting back tears because what she gave me in that moment was so huge. I've always said if I could inspire one person, then my job is done. And she told me that I had inspired her in that way. And as an artist, it's really scary to get up here, especially when you wrote the song and people don't really know it, but it's just so amazing that God really works through my music, works through me to be able to reach whoever needs to hear that. And it's just such an honor and blessing to know you and to be able to be invited here today. And I'll never forget that story, and I'll never forget that phone call because it had such a big impact on me. And this is what I love to do. This is my dream. So I'm just really honored to be here. And yeah. Uh-oh. Seems like we're getting something working here. Yep. Yeah, if we could just, when you're ready, turn that up a little bit and start it over, I'll be ready. Thank you guys so much for your patience. I really appreciate you. Yeah. Thank you. I guess you wonder where I've been. I searched to find a love within. I came back to let you know. Got a thing for you, and I can't let go. My friends wonder what is wrong with me. Well, I'm in a daze, from your love, you see. And I came back to let you know. Got a thing for you, and I can't let go. Some people go around the world for love, but they will never find what they dream of. What you won't do for love. You tried everything, but you won't give up. In my world, only you make me do for love what I would not do. My friends wonder what is wrong with me. Well, I'm in a daze from your love, you see. And I came back to let you know. Got a thing for you, and I can't let go. And I only want the best, it's true. I can't believe the things I do for you. What do you want to do for love? You tried everything, but you won't give up. In my world, only you make me do for love what I would not do. Yeah, make me do for love. Make me do for love. Make me do for love. Make me do for love what I won't do. What I won't do. What I won't do. Yeah, what I want to make me do for love. Yeah, make me do for love. Make me do for love what I would not do. Thank you guys. Thank you so much. Thank you. So next I'm going to do the very first song that I ever put out into the world. And this is the one I was telling you about earlier, that they wanted me to sing about a broken relationship. I was like, no, I'm going to sing about a broken system. And this is my song called I Just Can't. And it features an incredible saxophone player by the name of B. Thompson. I just love him so much. He's just so incredible. So this is my song called I Just Can't. Enlisting of the pain that remains, illusions maintain. Just can't let you get away with that game you're trying to play. This is a new day. This is a new day. Forget what you think you know. Open up your mind and grow. Cause I can, I can, I can. I just can, I can, I can. Focus on the truth that you're spinning. If we're losing, are you really winning? No, cause I can, I can, I can. I just can, I can, I can. Undercover thief, yeah, lying through your teeth, yeah, who you tryna be, yeah, yeah. Cause all I see, cause all I see is lack of prosperity, no camaraderie. Remind yourself that you're not the only one who needs wealth, yeah. Try to think about someone beside yourself. Don't get beside yourself, yeah. Just can't let you get away with that game you're trying to play. This is a new day. This is a new day. Forget what you think you know. Open up your mind and go. All your lies are crashing down. All crashing down, crashing down, crashing down. Cause I can't, I can't, I can't. I just can't, I can't, I can't. Bet you didn't know that that's how this gon' go. Say the truth always unfold. Prove it's not silver coat. Then you'll be the lie. It's never told. Just can't let you get away with that game you're trying to play. This is a new day. This is a new day. Forget what you think you know. Open up your mind and grow. Cause I can, I can, I can. I just can, I can, I can. Focus on the truth that you're spinning. If you're losing, now you're really winning. No, cause I can, I can, I can. I just can, I can, I can. Cause I can, I can, I can. I just can, I can, I can. Thank you guys. Thank you so much. I really appreciate you. So there is actually a music video for every single song that's my own today and a few others that I don't have time yet to share with you. So please go check that out. My name is Kelsey. It's Kelsi, Marie, Marie. You can find me at Kelsey Marie Music or Kelsey Marie Music 317 anywhere you look. And I would just love to connect with you. So please do that. This next song is a song that I wrote because, you know what, throughout all my life I've been doubted. I've been looked down upon, whether it's because I'm tiny or because I'm a woman or whatever it might be. There's always reasons for it. And I have always had the grace of God to be able to stand up on my own 2 feet again. And I feel like we all feel that way. So this song is just kind of a fun, confident way to say, don't doubt me because I will prove you wrong, okay? And I know we all feel like that, all right? So this is my song called Underestimated. Yeah, yeah, yeah. Ah, yeah, yeah. Ooh. Yeah, yeah, yeah. Ah, yeah, yeah. Ooh. Constantly underestimated, but you won't catch me debating. To me, I already made it. It's my reality I created. I would never, ever, ever, ever fake it. It's history I'm making. It's system needs some shaking. Traditions I've been breaking. Truth won't be forsaken. Oh no, they can't take it away from me. I'm so much more than what you see. Yeah, yeah. Everywhere I go, people think they know, but I'm so much more than what shows. If you don't know, now you know. Yeah. If you don't know, now you know. Everywhere I go, people think they know, but I'm so much more than what shows. If you don't know, now you know. Yeah. If you don't know. Now you know I love it when they doubt me. That's my ammunition. No, you cannot stop me. Cause I'm on my mission. Watch what they take. Careful what you're giving. Ask yourself for who are you living. So many in my ear telling me the things they think I wanna hear. But you can't control me with that fear. You don't know who you're dealing with here. Been underestimated all of my life. People think they know, yeah, but I'm so much more than what shows. Yeah, if you don't know, now you know, yeah. If you don't know, now you know, yeah. Now you know. If you don't know, now you know. Thank you guys. Thank you so much. So this next song, you know, I am a very small person and I just don't really grow. So I've always had this funny phrase, just tiny but mighty, don't forget. And this song came into my head probably over 4 years ago now, and I just couldn't get it out of my head. So I thought, okay, well, I have to go with this. And I decided to go ahead and use it to really call out misogynistic behavior, but as well as showcasing how important men are, that we need the balance between men and women. There's an incredible video for this song that I really got to showcase some really beautiful Indianapolis talent. So please go check that out. It's on YouTube. This song is called Tiny But Mighty. Money, 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 all I ever hear said, I don't need your money, get that out of here. I said, money, 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 all I ever hear said, I don't need your money, get that out of here. Tiny but mighty, don't try me. Never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm tiny but mighty, don't try me. Never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm tiny but mighty, don't try me. Never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm the bride you can't bribe me. I'm the one you can't deny me. I said I'm boundless, so untie me. Ain't no need to pacify me. Please don't classify. No need to over-sexualize. Please intellectualize. Open up your eyes, recognize how much more than what's between my thighs. More than you could ever fantasize. Y'all keep trying to minimize, but you never stop my rise. I'm always winning, cause I'm my own prize. Money, 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 all I ever hear said, I don't need your money, get that out of here. Said, money, 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 all I ever hear said, I don't need your money, get that out of here. Tiny but mighty, don't try me. Never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm tiny but mighty, don't try me. Never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm tiny but mighty, don't try me. Never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said, please let me break free of this misogynistic misery. Y'all know this ain't your entirety, but please know I'm sick of it entirely. No way I could take it mildly. We way past second child leave. Said you're better than this. Yeah, you should never have to steal a kiss. Somehow the mistreatment gets dismissed. But here we are pleading for a shift. That's what I'm here with. Sick and tired of hearing the same. Money, 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 all I ever hear said, I don't need your money, get that out of here. Said, money, 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 all I ever hear said, I don't need your money, get that out of here. Tiny but mighty, don't try me, never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm tiny but mighty, don't try me, never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Said I'm tiny but mighty, don't try me, never enough money to buy me. Don't even care if you could fly me. Not dealing with you up your slimy. Oh yeah, I know you ain't used to this, but that's time to wake up and see we live beyond the history. Thank you guys. Thank you so much. Appreciate you. So I'm going to really switch it up. I'm going to kind of slow it down here a little bit. This next song is very, very important to me, and I really actually refer to it as my heart in a song because it took so much of me, and it was really a true, true gift from God. It was a moment that I couldn't stay silent, and I had to speak up. I had to use my voice, and I really like to let this song speak for itself because I think it does it so well. But yeah, this is my song called Freedom. Heart fully broken, can't go on like we ain't already knowing. Can't hear the words unspoken. The truth is our whistle blowing. Black men murder while the police lights are glowing. Tell me why they coincide with the one who commits the crime. All I'm asking for is look in the eyes of the ones you seek to minimize. Take them home and memorize. See from the inside, see in a new light. All we're asking for is human decency, just to treat people right. We're all human, doesn't matter black or white. Just need you to gain the sight that we all have the right to life. All we asking for is freedom, 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 freedom. How can it be that's the real history, let alone a current day reality? How can they question you but not me? How is it the difference is all they see? Claim to set free, but all I see is new forms of captivity. When will it be over? When will it be through? It starts with me and it starts with you. It's not about what you say, it's about what you do. It's time to fight for what's right and what's true. I'm here to show the world that I stand with you. Freedom, 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 yeah, freedom, freedom. There's no time for deliberation. The time is now to heal the nation. Equality is through being patient, and freedom is standing adjacent. This generation is done being complacent. Where do we go from here? Start from one simple step, come from love, not fear. When you can only see the world from your perspective, it's easy to get overprotected. Just remember, it's always a limited view. It can be deceptive. Open your mind to be receptive. It's up to us to change the directive. For too long it's been neglected. No more immunity. We stand together, dignified unity, to love and protect our black community. Freedom, 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 freedom. Thank you guys. Thank you so much. All of my songs are really gifts from God, truly. A lot of times I'll just say a prayer and they'll just come right through. And the next song I'm going to share with you, it's very fitting that it comes after freedom because it's how I wrote it. And I'll never forget being absolutely terrified. What am I going to come up with? It has to be strong. And I said a prayer, God, what do I need to hear? What does the world need to hear? And this is the result. So I just want to say a huge thank you to God for all that I'm blessed with, okay? This is my song called Empowered, and I want you to turn to it anytime you're feeling low, anytime you need to feel that power, I want you to turn to this song, okay? This is called Empowered. Feeling more lonely than I've ever felt. All these things I never dared. I gotta heal myself. I met my inner being and now I'm seeing. And now I'm empowered and I feel the power. And now I'm empowered and I feel the power. Now I'm empowered and I feel the power. And now I'm empowered and I feel the power. For the first time I'm looking to nothing and no one. Takes a real one to know one. We all come undone, but will you look to the storm or the sun? Will you stand strong or will you run? Realize all along you are the one. Made my inner being, now I'm seeing. And now I'm empowered and I feel the power. And now I'm empowered and I feel the power. And now I'm empowered and I feel the power. And now I'm empowered and I feel the power. There's my inner being, she's so beautiful. Why have I been hiding her? Why have I been denying her? For the first time I see clearly, met my inner being, now she's singing, she's singing. And now I'm empowered and I feel the power. And now I'm empowered and I feel. And now I'm empowered and I feel the power. And now I'm empowered and I
Thank you guys so much. Thank you so much for being here. Once again, my name is Kelsey Marie. Please don't forget to follow me. I would totally love to connect with you guys. You can find all of those songs anywhere that you listen to your music, and there's also incredible videos. Thank you so much for having me, and I hope you enjoy the rest of your day. Thank you guys so much. Thank you.
for me changing my lupus story. So I'm going to just read a brief bio about her. Carla Day was diagnosed with lupus January 1988, and having struggled and persevered over the disease for more than 30 plus years, has dedicated her mission to helping others impacted by this disease. She has been volunteering and serving the Lupus Foundation America Indiana chapter since 2010. Since joining the organization, in 2012 she spoke before the House of Representatives. In 2013, she was named the chapter's Volunteer of the Year. In 2015, was inducted into our Volunteer Hall of Fame. In 2016, was honored to be named the National LFA Volunteer of the Year. And in 2018, was elected as the LFA Indiana Board Chair. She has done so much for our chapter and in our state, really. She is the support group facilitator for the Indy East Support Group and the visionary for the Faces of Lupus fashion show and the PATH program. The PATH program is the Patient Access to Healthcare program that provides support to lupus patients experiencing financial difficulties. She also serves on the Lupus Walk and in the Loop Symposium planning committees, and also is part of the LFA Advocacy Task Force group. She's married to Willie Day, currently serves as the Nurses Guild president at St. Luke Missionary Baptist Church, where she's been a member for more than 30 years. Carla enjoys reading, cooking, traveling, and spending time with her family. Please welcome Carla to the stage.
I want to thank Chanel for that introduction. As she had stated, I have been living with lupus for 34 years. I do talk with my hands, so if we could get this mic to work, it might work better because this mic might move a lot. I'll try my best not to. I want to thank everyone for the opportunity of being here. It is a great passion of mine to help educate, share my story, and be able to pay it forward is what I usually say. I'll share with you some of the things I've been through with my lupus, and I will tell you I don't look like what I've been through. So I do hope that today you've learned a lot about lupus, you understand it a little bit better, because it is a disease of mysterious, it's a mystery disease. It's from day to day. So, excuse me. So I'll go ahead and get started on what I have prepared. For many that don't know, lupus is the Latin word for wolf. So to give you a better understanding of what someone with lupus goes through, just imagine a wolf attacking you every day. That's sometimes what it feels like. We don't know from day to day what's going to happen when we wake up. But if you just can imagine each and every day waiting for that wolf to attack, that's what it's like living with lupus on a day-to-day basis. As it has been stated earlier, lupus is an autoimmune disease that can't determine the foreign invaders in our bodies, so therefore it attacks self. I won't go over all of that because it has been discussed before. 90% of those with lupus are women, as it also, testing. Thank you. 90% of those living with lupus are women. As stated earlier, women of color, Asian descent, and Hispanic are at a higher risk and have it more severely. One of the things about lupus that makes it hard to diagnose a person with lupus, lupus imitates other autoimmune diseases. So most lupus patients, before they're diagnosed with lupus, they could be tested for MS, sickle cells, HIV, and the list goes on. For me, it took them 2 years to diagnose me. They thought I had mono, they thought I had MS, they thought I had sickle cells, they even thought I had HIV because of a blood transfusion. It wasn't until I started having severe joint pains that my primary doctor sent me to a rheumatologist, which is the primary care doctor for lupus patients, before I was diagnosed with lupus. So that is one of the reasons it is hard to detect, because it impersonates other autoimmune diseases. As it has been stated also earlier, each person is different. It attacks us differently. I, too, have had some of the things that have been stated today. And just to share with you my lupus journey, again, I was diagnosed in January of '88. In June of '88, lupus attacked my nervous system, shut it down, and I was in a coma for 6 weeks. Lupus has also attacked my blood and dropped my platelet count to where I was internally bleeding, that I could have internally bled to death, so they had to remove my spleen to stop the internal bleeding. Lupus has also attacked my kidney, which today it is damaged. I do have to do urinalysis tests often to see how much protein is getting through, because that is a sign of kidney failure if it is too high. Lupus has attacked my heart, my lungs, and my joints. It's also attacked my skin. So again, I tell you, I don't look like what I've been through, so that's why it is a mission for me to share. Thank you. I've also had the Cytoxin, which is the chemotherapy. Lupus is not cancer. A lot of people think it is, but it is not related to cancer, and it is not cancer. It is stated that there's not a lot of medications for lupus, so therefore we use a lot of different other autoimmune diseases medications to help us. We do have Benlysta now, which I am now taking. So as we get in, as lupus evolves and we learn more medications hopefully will come out, but until then we have to take what they think will help at that moment of a flare. Which I've had the Cytoxin twice, which is the chemotherapy that Chanel had talked about earlier. And I think Brian had mentioned there's about 36,000 lupus patients within Indiana. However, as an organization, we're not capturing a lot of them, and that's because we need to do better in getting lupus out there more visually, bringing more people in and educating and bringing awareness about the disease. And that's kind of one of the things that I'll talk about a little bit further on. Lupus is a disease of flares and remission. We all want to be in remission, but because we're in remission does not mean we're not feeling 100%. Remission only means that it's not attacking our organs. We still have the rash, we can still have the joint pains, we can still have the fatigueness, and we may not just feel up to doing something that particular day. So I think that's where that misconception comes in, is that when we don't look sick, it's because we're not in a flare. A flare is when lupus is active and is actually attacking us. So a lot of times you won't see that because we're either in the hospital, we're either at home in the bed, whatever the case may be. It's a day-by-day case for each person, as you heard from the panelists earlier. When I was diagnosed with lupus, the first 2 years from '86 to '88, that's when it attacked my blood. I had a lot of other issues, but my family doctor didn't understand what was going on or why I was having those issues. It wasn't until, like I said earlier, the joint pains that I was having, when she sent me to the rheumatologist and she looked at everything that they had already done, she tested me for lupus. Now, I will say, when I was first diagnosed with lupus, I was rebellious because, one, it was a disease that I've never heard of, so it couldn't be that bad. Two, I was hard-headed, and I felt whatever she said not to do, it's not going to be that bad. So I had to learn trial by error. I had to learn the hard way. Everything the doctor told me not to do and I did, I ended up at Methodist Hospital. Still being stubborn, still being hard-headed. It was one of those things that when I came out of the coma, I realized, okay, I have something that, one, I don't understand. Two, nobody else has it. Three, why do I have it? And four, where did it come from? After I evaluated all those questions, two of my cousins was diagnosed after me. Unfortunately, both of them have passed away due to complications of lupus, but yet I'm still here. I went through a lot with mine. They didn't go through as much, and they were much younger when they passed with lupus. So it has become a mission of mine to help people understand what you see is not what we're going through. Understand that lupus is scary. It is a disease that a lot of times people look at us and we're hypochondriacs, or we're using our health to not do the things that you think we don't want to do, and that's not the case. Lupus is, it's really, as I think Chanel or someone said earlier, it sucks. But the one thing that I can say that helped me is when I changed my attitude, when I changed and accept what I had and how to live with it, it made all the difference within myself as well as within my family. Those that know me, and there's quite a few that's here, one of the things that I always say, and I say it often, once I accepted that I had lupus, accepted what it is, and accepted the changes that it was going to make in my life, I became okay with that because I was like, hey, this is what God has given me. You do what you need to do to be here, do what you, to take care of yourself. And the attitude, I had to change that attitude. And the attitude that I use is, I have lupus, lupus don't have me. So when I realized that, it was, thank you. When I start saying that every day, and I know Michelle, Monique, most of them that's here that has lupus, they hear me say that often. And I'll even say it to them on their bad day. Not that you're giving up. It's just when you let any health condition that you have control your life, then I feel it has won. So when you control it, you have won, even on your bad days. Even when I'm at home and don't have the energy to even take a bath. Trust me, those days do happen. I have lupus, lupus don't have me. We talked earlier about support. Sadly, there are a lot of people with lupus that don't have the support that really is needed, because sometimes we already are secluded, depressed, we have anxiety, financial impact. All of that comes into play because, like Michelle stated, she doesn't work. There's a lot of lupus patients that lose their jobs because of their health condition, excessive absentee from being worked. A lot of different things go into play, not just with lupus, but within health conditions in general. But when you have that support system, and I'm blessed to have my family who I couldn't ask for a better support system, but the people that I've met over the years that we have built a family and the support that we give each other. Some lupus patients only have the Lupus Foundation as their support, and we have to do better. If you have a family member that has lupus, you understand it. Find out more about it. Educate yourself, because on a bad day, to have someone say, oh, well, you don't look sick. Well, what does sick look like? I mean, like people tell me, oh, well, you don't look like you've been in a coma. Well, what does being in a coma look like? So understanding lupus or understanding any health condition is very supportive. It helps. It's encouraging to say, hey, they went out, learned about the health condition that I'm dealing with, and that's very uplifting. It's encouraging. And one of the things that I use often, I had to kind of go back and look at, over the years, what lupus was to me. And when I look at the word lupus, it's love, understanding, prayers, unity, and strength. Those 5 things, it spells lupus, but that's what got me through every episode. It was the love of my family. It was the understanding of my family. It was the prayers of my family. It was the unity of my family. And it was the strength of my family. So I have lupus, but together we're fighting this battle. And oftentimes, each person, you need that in your corner. You actually need the love. On your worst day, when you don't love yourself, someone just to come and say, hey, you need anything? I got you. Or, hey, I understand what you're going through. I may not have lupus, but I understand. Hey, I'm praying for you. If there's anything you need, I'm there. Hey, together we're going to fight this. And then even on my weakest day, their strength sometimes pushes me to be able to move forward or to wash that dish or wash a load of clothes or whatever the case may be. The hardest thing for me, the life-changing thing for me was not being able to do some of the things that I want to do when I want to do it. Me being hard-headed and stubborn as I am, sometimes I push myself, which that's not good for a lupus patient, because sometimes when we push ourselves a little bit further trying to prove something to other people when you really only need to prove it to yourself, that do what you can, when you can, and at the ability that you can do it. So if I can leave anything with anybody today is that has lupus, is first, reevaluate yourself. Evaluate what you're going through, understand what you're going through, and then change the attitude about it. The attitude plays a very, very important part, and I'm not speaking from just saying, I'm speaking from experience. That made all the difference for me. What a lot of people don't know, that there are 4 types of lupus. It's the systemic lupus, which mostly is referred to as SLE. That is the internal. That's how I explain it. That's the one that attacks the organs and everything on the inside. Then there's the cutaneous or the discoid lupus. That is what I call the outer lupus. That's the one where they see the rashes, they have the ulcers, they lose the hair. They have the Raynaud, I know I'm pronouncing it, thank you. The Raynaud is where their fingers get purple and things of that. So, and then there's the other 2 is the drug-induced lupus, which is the medications that we take. And actually what happens is it causes lupus-like symptoms. It's not lupus per se, but it looks like lupus because of a certain medication a person has taken. And then there's the neonatal, which is where a mother who is pregnant, she has antibodies that act like lupus, and that's causes that. It's not that the baby has lupus, but those 2 are not as common as the first 2. I can't say one is worse than the other. I have both. I've actually had to experience the lupus attacking my entire face, and I had what my lupus didn't recognize my own skin and set up a bacterial infection in my entire face. I have a picture. If I would have given it to them, I could have showed you where I had white, crusty blisters all over my face for about 3 months. I can honestly say that was probably the lowest point in my life, because that was the first time people could see the lupus. Not being vain or anything, but it was just hard to get through that, because it was a constant reminder that you have a condition and this may not go away. But as you can see, it cleared up just through the medications, and again, the process of understanding what my body was going through at that time. But, you know, like I tell everybody, lupus is no joke. Not downplaying any other autoimmune disease, but I do call lupus the hodgepodge or the melting pot of all autoimmune diseases. And you're probably asking, why do you say that? Lupus can attack every part of our body, is fair game, is the best way to explain it. Such as MS, it's going to attack the muscles. They do have some of the symptoms that we have, but lupus can attack the muscles. Sickle cells, that attacks the blood. Lupus can attack the blood. The list goes on and on. So that's why I call it the melting pot of all autoimmune diseases, because it attacks everything. Nothing is off the table. So like I said, I do see quite a few of my lupus warriors here today that I've met on my journey. It's been great for me, the passion of educating people about lupus, me sharing my story about lupus, is to hopefully be able to encourage someone that you can live with lupus. You will have your good days, you will have your bad days, but it's all about the support, the bonding and understanding the disease, and being able to just cope with the bad days, and being okay with saying no, being okay with not being able to impress everybody. Because if you're not able to impress yourself and do for yourself, then you'll be gone and they'll be looking for a new friend. It's not, you know, sometimes you have to just say, hey, this is me, this is what I have, and I look at it this way. If it's a true friend and understand what you're going through, then they'll understand and they'll be there for you. If it's someone that's just there for a fly-by friendship, as many of us have lost friends because of what we go through with lupus. Don't feel bad about it. Love yourself first. Understand what you're going through. And if they truly care about you as much as you should care about yourself, they too will understand what you're going through and learn and educate themselves. about what you're going through and not be judgmental, as a lot of us have experienced. I will say that the depression and the anxiety, all of that is real. I know when I was going through all of my ups and downs with lupus, I was in a dark place at one point in time, and I share this story with everyone. It was my mom. She's the rock who actually gave me the push. When I got out of a coma, I couldn't walk, I couldn't talk, I had to go through therapy, and I really was ready to give up. I told my mom I would rather die than live with this disease. Those were my exact words, to be honest. My mom looked at me, she said, if you want to fight, I'll fight with you. But if you want to die, you'll have to die alone. Now, as a person listening to this, all I heard was, you want to die, you're going to die. I ain't hear the fight part, you know. But I know I needed my mom. So my mom is a very strong person in tough love, and what she was showing me is, I'm here for you regardless, but you can't give up. And if you are going through on your worst days, don't give up. If I can be of help to anybody with lupus, which is how I probably have met half of the people I know with lupus, such as Chanel, such as Michelle, such as Monique, Trina, I think Charity in the back. I've met all of them because someone saw in me something that was going to help them. So I thank LFA for the 12 years that I've been involved with them. But as I told Brian when I first met him, this is a ministry to me. This is not a fly by the night. It is a ministry. So everybody has a purpose in life. I feel this is my purpose, to be here to help educate, advocate, help someone along the way. Because in 1988, all I had was my family. I didn't have a LFA. I didn't have support groups. I didn't have any of that. So my trial and error was truly just me and my family chugging away, moving forward. And I am thankful to God for using me to be able to share my story, share my life, and my lupus with you and those that I have come in contact throughout the years. But it doesn't stop here. It continues. We need support. We need funding. We are a small organization, but we have big dreams, but we can't do it by ourselves. We need a lot of help. We need a lot of funding to be able to do the programs. I talked with Chanel and Brian about all these ideals that I have to help other lupus patients. I'm very proud of the PATH program. I think that's a great program that we have to help lupus patients. Just to give you a little bit about that program, it is a program to financially help lupus patients through a financial hardship. It pays rent or mortgage. It helps with medical procedures if needed. It pays for medications. It also can pay for medical transportation. Whatever that lupus patient needs at that moment, we try to be there. And just to share one of the success stories that we just had recently, we had a young lady that was lupus. She was homeless, living in her car, and her friend called, not her, her friend called out of concern for her. And our organization, with the PATH program, we was able to get her into a hotel for 2 weeks to help her while we worked on other avenues for her to get transition housing, and that's what we did. And if we didn't have the PATH program, no telling where she would have been or what would have happened. And we were very grateful that we was able to do that, as we've helped some other people with that program. So I'm very passionate about that program. I'm very honored that I created the program, but I'm very honored to see it working and being able to do what the vision was for it to do. I could go on and on, so I'm not going to stay up here all day and keep everyone. But I do hope that I have said something, I've shared something, I've passed along something that may be beneficial to you, may have been a help to those that have lupus. I want to thank Monique for coming. She is part of the support group. Michelle and Trina and Chanel, they were all in the Faces of Lupus fashion show that we do every year to raise funds for lupus. So, again, if you have an interest of being a part of our organization by volunteering, because we too are a strictly volunteer basis, other than the 2.5 employees that we have, we definitely can use your help. We're also looking for board members. If there's anyone interested in being part of the board, you can talk to Brian or Robin, who is here as our board chair. We have a lot of work to do, but we've come a long way. And I'm glad to see the change from 88 to 2022 to where I've grown and I've become a better person because of what I have, which is the lupus. It's made me the woman that I am today with the love and support of my family and the strength from God. So I thank you. If you have any questions, I'll be more than happy to answer them. No questions? Great. Oh, sorry. Okay, don't move? Okay. Brian, I think there's summings in you. You need to go here?
Can we get another round of applause for Carla, please? Yes. So, with all you've done in the lupus community and just for us at this conference, we want to present you with a gift on behalf of the Lupus Foundation Indiana chapter and the National Center for Racial Equity and Inclusion. Just to thank a small token for everything you've done. Yes. Yes. Of course, well, thank you. All right, we can let you go now if you want to. All right, next, Brian and Chanel will go ahead and thank our partners for us.
Thanks, Camille. I have a lot of people I'd like to thank. I'll make it quick. I'd like to thank Camille in particular and David. Camille was the one that reached out to us and asked us if we'd like to be involved in this event today, and we absolutely jumped all over it. And so thank you, Camille, for that. They are terrific people. I'm so impressed with their organization. I'm so impressed with Martin University. And David and I were talking earlier about ways to sort of expand our partnership. And so I'm looking forward to working with that team on an ongoing basis. I want to thank Rhoda and Michelle and Chanel, our panelists today. They were great. They're terrific individuals. You know, everyone I've met who has lupus and who's dealing with it is so strong and such a fighter. We've heard that term a lot today, but it is so true. You know, I get inspired every day when I talk to the people that we serve and that we work with. I'd like to thank my 2.5-member team that Carla mentioned. Debbie Campbell is our half member. She couldn't be here today, but she's really kind of the backbone of our team. And I want to personally thank Chanel. She coordinated all of our involvement in this today and so many other things that we're doing. So thank you, Chanel, again, for being a part of our team. And I want to thank Arinia for making it possible for us to participate today. And Ginger Webb traveled a long way to be here today. And so, Ginger, thank you so much for supporting us and you know, being a part of this event for us today. And I'd like to thank Dr. Geraldino, who's not here at the present time, but she traveled a fair piece, too, to be here. So thank you very much for your support, Ginger. And thank you to all of you for being here. We appreciate your support, your participation, as Carla mentioned. And I'd be remiss if I did not thank Miss Carla Day. She is like the Lupus Energizer Bunny. She has been, I met Carla about a week after I took this position, and as we were preparing for the fashion show, and she's been a big fan of mine. I am a huge fan of hers. I could talk for hours about all the things that she's doing, and she really has been a champion for us for a very long time, and we appreciate all that you do for the lupus community, Carla. But thank you to all of you, because everybody who's a member of this community is a warrior and contributes to our collective success And that success is defined by us serving and supporting those with lupus. And so please help us spread awareness. Certainly, resources are needed to do that, but what's really important is those that we serve. And that's what drives us, that's what keeps us going, and so we appreciate all of your help and your efforts in helping us to do that. So thanks again. I hope that you have a great rest of your afternoon and the rest of your week. Thanks.
Can we get another round of applause for Brian, please? On behalf of the National Center for Racial Equity and Inclusion, we're greatly appreciative of all of your partnership, all of what you all have done to help us do. And if I could have Brian come back up here, please, and Chanel as well. We actually have a gift for you all, too. And so we have one for you all as well. And so, just so that you all can see it, we have a thank you plaque for them as well.
All right, and we just have a couple more organizations that we would like to thank today. So first, we would like to again thank the Arthritis Foundation for coming out and presenting to you all on behalf of how arthritis affects lupus itself. So if you want to give another round of applause for them. And then we would like to also thank Healthcare Initiatives. They could not be here with us today. However, they had a great dealing in making today happen. So we also want to acknowledge them and thank them for their partnership as well. All right, so as we kind of conclude with the session portion of this conference, we want to just thank everyone who joined us virtually. I know you couldn't be here with us in person, however, your impact is still greatly appreciated, and hopefully you gained the same advocacy as those who joined us in person today. As far as everyone here in person, we can go ahead and transition to the community resource fair portion of our conference today. So we have a few organizations in the back that greatly impact the community from a healthcare standpoint. So visit any tables that you would like to, or all of them if you would like. You can get more information from the Lupus Foundation Indiana chapter, from Chanel, who's over there currently. Or if you'd like more information about the National Center for Racial Equity and Inclusion or Martin University itself, you're welcome to visit our table as well. Thank you.